As we initiate chaos theory guarantees that we'll play like lightning shots, sounding like thunder. For every time in the face that it hits us, we're faster. Well, they should know by now. Can they see? The world keeps trying to shake us. It only wakes us. The pendulum swings. The pendulum swings. It's in a beautiful darkness, only another. It's full steam ahead, full steam ahead. All about the Petty Express, misdirected from the start. It's a runaway train, I come a freight train, I come a freight train. In a beautiful darkness, the Petty Express. In a beautiful darkness.
Hey, you guys, good morning. I am safe. I hope all of you are safe and with power, or at least in an area that you can have power and let people know that you're okay. There were so many storms, and here I completely forgot I also had a doctor's appointment. So I thought, okay, I will do the thing I loathe to do, which is cancel mornings with Mo for, um, to sleep in so I can be functional for the trial, only to remember that my ridiculous behind had scheduled a doctor's appointment. And there is something to say about having a doctor finally that listens. Um, Now he keeps Jedi mind tricking me into showing like human emotion with genuine compassion and listening. Um, I have asked you not to use those on me. But it was nice to be able to talk to him about a lot of my concerns, and, even though I've been communicating with him over chat, there's a lot of nuance that, I can tend to, overanalyze and get stuck and spiral in, so being able to talk face to face and having someone that listened and just, was interested in my input as far as, any sort of patient care. I'm beginning to realize how rare, that is. Um, Snipe, I don't know. We are looking at another round of potential storms, and I quite candidly, did not sleep that well, last night, so, uh I am fighting 2 internal battles right now. I first of all, I love being on stream. I love hanging out with you guys. It's so much fun even if we're on a god awful soul-sucking trial. Um, so I love that, but I'm also feeling and I'm working on sitting in the discomfort of going at my own pace. To make a long story short, um, I I am still too type A to to credibly function as a human being, um, but I now know that I have limits, and I do have to go by, my own sort of look, I don't know why I bought these at Hobby Lobby. I know why I bought the god awful wreath, bow of burlap because of course, but, I have 6 flags of caution, like, for when the court of public opinion just look, I went to my happy place yesterday, Hobby Lobby, and, okay, I I I need to preface this with I think, I may have found the closing bow, okay? Now, it needs some tweaking, and I need to do some constructionology on it, uh, but you guys yes, it is a door bow. Yes, it's the Grinch. Yes, I did test it on in the store. It does in fact credibly fit on my head. Um, I don't know, I find it to be just a little too subtle still. Um, Also, I have made more Grinch references in 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 this trial. So I do need to figure out constructionology why. Yes, I you act like I wouldn't. I had a vision, I had to see if I could balance it on my head. I was going to buy it either way, is the whole end of it because, so if you do like this for more of just a Christmas decor, which I can understand, why you would, look at this and see Christmas decor and not, a comedy prop, um, it is $10. All of, Hobby Lobby's Christmas stuff is on, well, 50% off sale because it's not even, the end of August yet. Uh Oh, I will have emotional eyeballs, like, uh, so so honestly, because I had to go and, I I realized that I tend to be much more blunt and to speak Moese when I have had to, pretend to be professional, so this was right after my kiddo's IEP meeting where I had gone in and done, like the advocate for my kiddo thing and, try to build bridges with the education team and set up, new goals for the new year. So I had done all of this adulty stuff. So what I might have said to the nice old lady, I apologize, ma'am, if you're watching, you know who you are. What I might have said to the little woman who was at the front of the Hobby Lobby was, when she's like, "So what are you looking for?" And I was like, "Do you happen to have, like, an evil Nellie Olson center? Like, if Little House on the Prairie got a little too close to Halloween, that's kind of what I'm looking for." Which is exactly what I'm looking for. I mean, that basically boils down to exactly what this is in my head. Nellie Olson if she had gotten attacked by a scarecrow. Um, which is an interesting look to wear into court, Commonwealth. But I am nothing if not a steadfast, method actor, Sean Penn, you me. And details matter, so I did have to get the aesthetic to go with the character I was trying to mimic and or mock. Any hoozle, you guys, all that is to say that if I'm a bit more squirrely today, we are gonna go at our own pace. We are going to try to get through, yesterday. There was a lot of heartbreaking, but really important testimony as far as nurse practitioner Gelada and, her unique, kind of interactions with Lindsay as a clinician, but then a lot of the things that she either overlooked or, um, basically reading ahead a little bit on X, she did not do well in the court of public opinion. She was all the flags. Um, and not just the burlap bow. But let's get into this. I am going to bump it up to 1.25. If it is too fast, I hesitate to do these on or to bump it up a whole lot on New England trials because they tend to speak fast anyway to a lot of the country. But if it's okay, let's try this and I will have closed captions on. Now, I did pick Law and Crime because sometimes when it's sped up and we're watching it from, you know, behind the present timeline, they have better closed captions that match in theory. Why Commonwealth? I mean, I understand that I am going full Carrot Top with my interpretation of that. But I say this, look, I'm no Cher or Ed or Lorraine Warren, but whatever demonic doll you stole that from, your apartment's you're gonna come home to a demonic infestation in your apartment. You done opened the lament configuration to get that bow out of the hell dimension from Annabelle. You might as well go home and put it back. You done Pandora's box the rest of us into the stupid dimension. Um Sorry. Again, not a lot of sleep, Mo. Less filter. May not always enter into any idea with kindness as the first goal. You have been warned, Commonwealth.
All rise. George entering.
Oh, that's the wrong setting. I was like, why am I so big in comparison?
Hey, all persons having anything to do before the Honorable William Sullivan, Justice of the Superior Court, now sitting in Plymouth, within and before the Commonwealth. Draw near, give your attendance, and you shall be heard. God save the Commonwealth of Massachusetts. This court is now in session. Please be seated.
You know, I agree more with God save the Commonwealth of Massachusetts. Like, that is added to my litany of prayers. I mean, look, part of it is selfish and for self-protection, but I like a lot of the people in Boston. I'd like in Massachusetts. Look, my brain thinks Boston, then Massachusetts, not Massachusetts, then Boston. It's geographic dyslexia. What can I say?
Good morning, Your Honor. May I proceed?
Yes, please.
Your Honor, before the court today, we have the continuation of the jury trial in the matter of Commonwealth versus Lindsay Clancy. Ms. Clancy is present. She is represented by Attorney Kevin Reddington. The Commonwealth is represented by Assistant District Attorney Jennifer Sprague and Assistant District Attorney Shannon Buckingham.
All right. Well, good morning, everyone. Thanks for your patience. I told you we got a little late start, but
Okay, I love Springer Donahue as much as the rest, but let's get into. Hadn't we talked to this woman? Okay, we must have just gotten to cross here. I thought that we had finished with. Oh God, do not call her what you want to call her. The other nurse practitioner, the good one.
Ms. Clancy is present. She is represented by Attorney Kevin Reddington. The Commonwealth is represented by Assistant District Attorney Jennifer Sprague and Assistant District Attorney Shannon Buckingham.
all right. Well, good morning, everyone. Thanks for your patience. I told you we got a little late start, but I appreciate you waiting for us. And so what I'm going to do is going to go through those questions. And then at that point, we'll talk a little bit about the schedule, and then we'll get right back into the trial. So first question, as you all know by this point, would affect your ability concern. Thank you. I'll probably be wrong again, but the best aspect, I think, probably similar to yesterday. Okay, so we'll go. We turn to the case. We'll take a break, hopefully around 11. Take a break from 1 to 2, and then we'll go into the afternoon, depending on how the case testimony goes. And then at the end of the day, I'll try to remember. Bring counsel over here. We'll talk about kind of where we are on the timeline of the case, where we are kind of scheduled for the week, and going forward. So I'll try and give you that, hopefully, this afternoon before I send you home. All right. So with that, we're going to return. There was a witness. Ms. Paul was on the stand. The Commonwealth had finished their direct examination, and we're about to begin cross-examination of that witness. So I would ask the witness if the witness could retake the stand, please.
Good morning. Good morning. You solemnly swear that the testimony of the evidence
I would like to say
Good morning.
for
Good morning.
nurse practitioner Paul, she is exactly who I hope I go to see. I know she might seem very severe and, very analytical, but I actually find that comforting. I actually find that she's very direct and, just says what she is thinking. She's not going to sugarcoat it. She's going to kind of tell me in a clinically professional way. I mean, obviously, she's not going to say, okay, that's a little delulu. I mean, but for me, she would make me feel much more comfortable than Jennifer Tufts or nurse practitioner Gelada. And that's the other part and component, which that I think does need to be taken into account with mental health care, that, nurse practitioner Paul may make me feel comfortable and able to relax because she's not going to emote. And, I don't she's an observer. She's there to do her job. She's, going to help me walk through this with logic and care. And that's what I would find helpful. But she is not incapable of tailoring her approach to what her clients need. But there is that other component that, for another patient, for another person, even with a similar, symptomology profiles, nurse practitioner Paul might seem too severe, too intimidating to open up to. So there is that whole spectra of what makes people feel comfortable, and how to incorporate different kind of personalities into mental health to make sure that everyone's needs are being met, in a realistic way.
All right, Mr. Reddington?
Thank you, Judge. Morning, Nurse Paul.
Good morning.
And if I understand, you now live and perhaps work in New Hampshire, is that right?
That's correct.
And are you still doing the same type of work that you were doing with the social health?
Yes, I am.
Excellent. Very good. You obviously are a very, very dedicated person to this field, if you will, and helping people that are pregnant women after they had birth and during that postpartum period, right?
Correct.
You work with Lindsay, and the reason you were involved with Lindsay is because, if I understand it correctly, her mother-in-law, Patrick's mother, Sue, works with a friend of yours.
Correct.
So basically, Sue asked her friend if she could reach out and have you kind of step in and help out.
That's correct.
And then that's what you did.
Yes.
And you stepped up and you treated this woman, obviously, with care and professionalism, in my opinion.
Thank you.
Your Honor, I would like to offer the records from South Shore Health, if I could.
Objection? Those records may be admitted.
Exhibit 222.
And I think in that delivery, Kevin Reddington, he expressed what a lot of us, casual observers have noticed and kind of just gotten from just her testimony on the stand, that I don't think we would have been here if nurse practitioner Paul was in charge of Lindsay's care and maintained charge of Lindsay's care. And that's incredibly heartbreaking. That's incredibly just crushing. And she may not see it, but I can imagine that this weighs heavily on nurse practitioner Paul. You can tell that she is passionate about making sure that women receive health care, especially pregnant women, especially women who are struggling post-birth. And I can only imagine that this is something that just eats her up alive. And I'm glad that we got an example of, because they are out there. I know this case is a highlight of the dumpster fire that is the medical industrial complex. But there are good practitioners out there. Yes, they're not as easy to find, but they do exist. And I'm glad we got to highlight at least one in this trial. But it is heartbreaking to know that we wouldn't be here. And that is heartbreaking.
In the course of your treatment of Lindsay, actually, you went so far as to give you a cell phone, if I'm correct. Is that right?
She did have my cell phone because I called her on my day off. Yes, sir.
Okay. I don't have any other questions, Judge. Thank you very much for your care.
All right. Counsel, anything further?
Clancy.
All right. Thank you. May step down.
Thank you.
Now, I'm going to try to go into Nurse Practitioner Gelada's testimony with an open mind as much as I can, given that I have watched ahead. What I do not want this to become is a witch hunt of all clinicians. And I think with our passion and our anger and our righteous anger, that this woman's cries for help were ignored. And the Commonwealth continues to act like she was just doctor shopping and pill popping. Um, it's insanity. And I can only speak for myself, but I told my doctor this morning that, me coming to him asking for an evaluation for mental health was a culmination of 6 months of me thinking about it, mentally, seeing if I was in a place where I would be open to meeting a new doctor, to discussing things, to, possibly, being in some emotional discomfort as we talk about stuff. So, and then making sure I was ready on my end to where I could be a good compliant patient before I even asked him. So while it might have seemed apropos of nothing, there was an intense thought process that went into this. And just having a doctor that listened to all that and just listened. If you find one, don't ever let them go. I mean, don't stalk them. Do not stalk your doctor if you find a good one, but just never let them leave. This is not coming out right, but I found a good doctor, and if you have complex medical needs, it legitimately is like finding the Arkenstone. Yes, I have to nerd translate everything, but it is like finding the Arkenstone, the One Ring. Yes, I mean, as long as I get a purple lightsaber, I really don't care where I'm ranked. I'm more of a Mace Windu. It's not that I'm flattered that I'm on your council and such, but I more go by my own internal moral code. I'm I mean, do I get better robes? And thank you, Matilde. Look, if I've mispronounced it, if you phonic it in, I will attempt it better, but I've had very little sleep and my brain is like, what are letters and why do we have to phonics? So let's give Miss Gelada about half 10% of, an objective chance. It's about all I feel the ability to muster today.
Good morning, ma'am. Stuff like that was right in quick fix. Watch your step, please.
Hey, good morning. I'm going to ask you to keep your voice up and speak into that microphone, all right?
Right here.
Yes. Turn it back to you, please.
Thank you. Good morning. Good morning.
How the hell did Phoebe Waller-Bridge get into this effing production? Oh, like Matilda? Thank you. I thought so, but then I thought, if you're ever halfway through a word and you're like, nope, this is not right, but you can't abort right there. You just have to finish that word knowing it's completely wrong, or you just break down. Never mind. Seriously, I thought that we kicked her out of Hollywood after she destroyed Indiana Jones. I'm just kidding.
Morning. Could you please tell the jurors your first and last name? Rebecca Gelada. And how do you spell your last name for the record?
Oh my God. What is it with females in this baby voice? I don't get it. You're an adult woman. You're what? You're 39 years old. Speak with some bass in your voice. I get that I have a deeper voice for a chick, but it is what it is, and I've learned to deal with it. For the love of God, what is up with this baby voice? I would feel ridiculous doing this. Maybe that's her natural register, but it doesn't strike me as her natural register. It sounds like a professional put upon voice. And why? Why? Females, explain to me why you do this. Explain to me because I don't understand it.
Record. JOLLOTTA. And what do you do for work? I'm a psychiatric nurse practitioner. And what kind of training and education did you do in order to become a psychiatric nurse practitioner? Thank you. I have my...
Thank you, bailiff. No. That's a purple flag. That's a good flag on the bailiff. That is a purple flag. We do not like lip smacking. That's a red card. It's a red flag right there. We do not like lip smacking. What? This voice is what they legitimately, if Mr. Mo ever needed to Noriega me out of Hobby Lobby, like I had, I had sealed myself in there with a hot glue gun and, Craftosis or something, this would be the voice that would get me out of my bunker. Um, good God. What is this voice?
Bachelor's degree from the University of Connecticut in Allied Health Sciences. I then went on to get my master's actually in counseling psychology in 2013 from William James College in Newton. I worked in the mental health field as a clinician in various positions for a time. Then I went back to school. I've been an RN in Massachusetts since 2017. I got my MSN in 2019, at which time I became a licensed and credentialed psychiatric nurse practitioner.
And where is that? Here in Massachusetts?
Yes.
Are you licensed in?
I can physically hear every muscle in your mouth moving to make the words that are coming out of your mouth hole. Take the water, drink the water, ask for another glass. You are obviously chronically dehydrated. Get a Werther's. For the love of God, stop. How can I hear every muscle that must be activated for you to make a noise, plus the little snot bubbles in between your teeth? I need her voice to I need Cross for my audio sanity.
Anywhere else?
No.
And so can you tell us a little bit about your work history?
Sure. I have worked in as a detox nurse at McLean. I have worked as a therapist in outpatient clinicians prior to becoming a nurse. I have worked in DMH respite facilities, and now I'm a nurse practitioner.
And when you were a therapist doing outpatient therapist, was that something you were doing on your own as a social worker, or were you associated with a practice?
It was part of my training after I got my master's in counseling in 2013. So I had a panel of patients, but I was under the supervision of a licensed provider. It was up towards getting my licensure.
And where do you currently work?
South Shore Health.
And how long have you worked for South Shore Health?
Since 2021.
And how did you come to work at South Shore Health? What was the role that you started?
I had been working sort of in general practice as a psychiatric nurse practitioner, but I was interested in working in women's mental health specifically. And at that point, I was getting training to become, more specialized in it. And when a job opportunity became available, I applied for it.
And what kind of training is that you were doing to be more specialized in women's health?
So Postpartum Support International is the certifying body so that somebody can become certified in perinatal mental health. I did the 2-day, well, actually it was a 2-day training plus a 3rd day specifically for the psychopharmacology track of it. And then I took a examination and passed the examination.
And so are you certified by the Postpartum Support International?
I am.
Now, sweetheart, let me tell you that looking up towards the invisible sky cats to give you the answer. Now, most people aren't as obvious when they're looking things up or when they don't know something, especially those who tend to be clinicians or in places of authority, especially mental health, because they want to look like they know things. They don't want to look like, okay, trigonometry teacher, we both know this is going to be a shit show, but okay. But normally what you don't do is telegraph the hell out of the fact that you have no idea what you're talking about, and or you are having a really, really hard time recalling essentially the formality and the education that got you the job in question. Do you oh, that was fun. It's not even storming outside. Oh. Okay, camera at any point.
As far as the South Shore Perinatal Behavioral Health Clinic, how did you become affiliated with that?
That was the job I applied to in 2021.
Okay. And so when you came to the clinic, who was running the clinic or who was the director?
Julie Paul.
And as far as the clinic itself,
We do not like Julie Paul. Oh my God, what is the backstory? Was Julie Paul competent at her job and she left because you were trying to screw? You were trying to screw with the clinic and make it ineffective. And she was like, fine, you know what? You don't want me here. You don't want my expertise. I'm going back to my home in New Hampshire. There's just a scotch of animosity here. And this is why I can't be a prosecutor, because I'd be like, you obviously don't like her. What are the deets? And there'd be like, objection. This has nothing to do with the trial. And I'd be like, listen, Springer Donahue judge, you know you want to know the deets as much as I do. Let's go to a voir dire.
what is the clinic's, what's the patient base, or who does the clinic service?
So we specialize in working with women who are pregnant and postpartum up to 2 years after the birth of their most recent baby. We offer medication management. We have a clinician on staff to do counseling. We have a few nurses that work in our program. We work with moms for any range of psychiatric disorders, including addiction.
And when we talk about the range of psychiatric disorders in women who are postpartum, what are we talking about?
Postpartum depression, anxiety, postpartum psychosis.
There is something so paradoxically wrong that it tweaks my brain to a level that causes me to pause. When you're talking about postpartum depression and anxiety and substance abuse problems and all of this with a really big smile, like allegedly in Minecraft, what level of SSRI are you familiar with? Like, what is your midichlorian count in the SSRI department? Because holy Jesus, ma'am, like what level do I need to hit to be that happy? I mean, just they don't work on me, but I mean, let's say we lived in a hypothetical Schrodinger's universe where SSRIs worked for me. What level do I need to take to achieve Disney medicated princess? Allegedly in Minecraft, again, I haven't slept well. You are in for snarky mo. There will be no filter. I apologize. This is probably going to get demonetized. It is what it is today. We're getting caught up. It is Stormfronty. I am not super duper, feeling the best. So that's the last apology I'm making, just in case you're new. Yeah, this is basically Mo that's like, I am done trying to hide. I am done trying to pretty up the obvious.
Bipolar disorder, panic disorder, obsessive compulsive disorder.
And so you mentioned postpartum psychosis. Have you yourself had the experience of treating women with postpartum psychosis?
I have, yes.
And how many patients approximately over the course of the last 5 years?
Approximately 5.
And how about postpartum depression and postpartum anxiety?
Hundreds.
And in the range of services that the clinic offers and the work that you do you oftentimes collaborate with other community providers to offer additional referrals or services to patients if they need it?
We do.
And how about when somebody appears before you and you believe they need a higher level of care than what you can offer? Do you have relationships with hospitalization programs, or are you able to make referrals for people for those services?
Yes.
Is that pretty common practice?
Yes.
And you mentioned that one of the services or one of the things offered to patients at the clinic is medication management.
Yes.
Is that a big part of what you do as a psychiatric nurse practitioner?
It is.
And what kind of training do you receive in order to be a prescriber?
So in order to be a prescriber, it's part of my master's in nursing. So you take courses like in advanced pharmacology.
Oh my God. I cannot tell you how much I do not want my doctor or any professional or a pilot or anyone that I'm placing trust in to talk like this. The fact that she's closing her eyes and she's having to say, so it was part of my like legitimately, this is all I am seeing. And I know it's exaggerated for my neurospicy brain, but all I am seeing is it was part of my master's degree and see, I used to do this, but then I have to do some tests and stuff, and I do chemistry. I always thought it was chemistrology, but it is in fact chemistry. This is all I am seeing.
Advanced health assessment pathophysiology. It's part of the coursework of my degree. And then you actually have to take a certification exam and you have to pass the exam. You have to go on and get a DEA license, a Massachusetts controlled substance license. You have to go on and get your advanced practice registered nursing license. So it's education and certification and licensure.
And so you've done the education, you did the certification, and do you have all the licensures that you just described here in Massachusetts?
I do.
And you also mentioned part of the services of working with social workers in the clinic. And what do the social workers do?
They provide short-term counseling to patients, again, because we specialize in up to 2 years postpartum. They could be available to provide counseling during that phase.
And traditionally, postpartum period is a year after birth, right?
Correct.
So why does the clinic offer support for women up to 2 years?
We do acknowledge that while the highest risk period is the first 3 months postpartum, some women can struggle later on in the first year. They may have symptoms that emerge 9-10 months in, so we want to really be able to cover them and treat them if that happens and get them stable.
And does it sometimes take some time to get a person stable?
Absolutely.
And would that be why the program or your program goes up to 2 years?
Yes.
I want to draw your attention to a particular patient, Lindsay Clancy. You're familiar with that patient?
I am.
And how did you become involved with the care of Lindsay Clancy?
I became involved. She had initially seen Julie, and Julie was going to be leaving the clinic in December, and she wanted somebody to take care of Lindsay, again, longer term, since she would be leaving.
And at that time in 2022, when Julie was leaving, how many psychiatric nurse practitioners were at the clinic?
3.
And that includes Julie?
Yes.
And so who was the other nurse practitioner?
Andrea Warden.
And fair to say, you had a conversation with Julie about transferring care of this particular patient?
Yes.
And did you have more experience than the other nurse practitioner in the field, if you know?
Not necessarily.
Consulting the sky cats for answers. No, I didn't think I had more experience, but she looked like my bestie from middle school, so I thought I was the best to take care of her. No, ma'am. Nurse Paul just said that you had more experience. There is a reason that the lawyer is asking you this question, and if you were competent at all at reading people, as you should be professionally, you would realize that she's trying to lead you. In fact, this has all been leading. You to say, yes, in fact, I did have more experience than that other chick. That's why I was totally picked for experiential reasons. Now, the fact that you are confused by this basic conversational back and forth and expectation makes me question your observational, your observational skills.
But as far as taking Lindsay on as a patient, you were agreeable to taking over for Julie.
Yeah, in all likelihood, Andrea Warden only works 2 days at our clinic, so it could have been that I was working 5 days at that time, so I would have been more available.
So do you recall when the first contact you had with Lindsay Clancy, what date it was?
It was November 29th, 2022.
And so that was prior to Julie actually leaving, right?
Correct.
And fair to say, on that November 29th date, you had an actual follow-up with Lindsay.
I did.
Do you recall if it was virtual or was it in person?
I recall that it was virtual.
Okay. And in the practice of the clinic, is there an option for patients to do in-person or face-to-face
Yes.
in-person visits? And how does it come about that a person is either in person or virtual?
Our model is that we do initial assessments in person. Because new motherhood is very busy, there's a lot going on, we would rather see you than not. And so sometimes it is just easier to log on to a screen. Sometimes if we feel like someone would benefit from that face-to-face assessment, we'll say, please book your next appointment in person. And I know I did see Lindsay in person on at least one occasion, but my first was virtual.
And as far as kind of that choice about whether a patient appears virtual or in person is part of the calculus, the patient's choice, what they want to have happen.
Yeah.
And if there were circumstances where you believed or insisted that an in-person visit was required, would you articulate that to the patient
Yes.
and then have them scheduled for an in-person?
Correct.
And as far as your first contact with Lindsay Clancy, were you aware that Julie Paul had done that initial intake with her in person?
I was.
And you had the chance to speak with Julie and to also review the records prior to meeting with her?
Correct.
And so were you aware that the day before, on November 28th, that Julie had some contact with Lindsay Clancy?
I was.
And that there was some phone interaction and there had been some messages sent to the clinic prior to you scheduling the meeting with her?
Correct. Yes.
So would you agree that there was an issue that needed to be discussed and that led to you to have this appointment with her prior to Julie actually leaving the program?
Yes.
When you met with Ms. Clancy, did you go through kind of a history of her presentation or present illness and kind of things that had occurred in the past?
I did.
And did you do kind of a nuts and bolts start to finish, or did you rely on some of the previous information she had disclosed?
I relied on some of the previous information she had disclosed, things like where she grew up, where she went to school, past clinical history, medication trials, but otherwise I would add my own clinical assessment.
Okay. And you were aware that in the history she presented to the clinic that she had previously been on some medications from another provider?
Correct, yes.
And that she started with Zoloft and Ativan and Benadryl?
Yes.
And that at some point she had visited the South Shore Hospital emergency room?
I believe it was November 16th.
And as a clinic that's associated with the South Shore Health System, do you have access to those records to review when you're dealing with a patient?
I do, yeah.
And so you're aware that when she went to the ER on November 16th, that they prescribed her trazodone?
I am.
And that she was reporting significant sleep issues at that time?
I was aware.
And then as far as the course of treatment at the clinic, were you able to review her course of treatment with Julie?
I was.
And fair to say that had been very recent, correct?
Very recent, yes.
Her first contact with the clinic was actually November 20th, correct?
Correct.
So you were aware that Julie had originally prescribed Prozac and had already changed the medication plan?
Yes, I was aware.
So in this meeting on November 29th, what was Lindsay reporting to you as the issues?
Would I be able to refer to my note, Your Honor?
Sure, you can.
I know most of it by memory, but just. So she had been taking mirtazapine, Remeron, at that point for 4 nights. So I believe she started it on November 25th. I was then seeing her on November 29th. She wasn't yet appreciating much difference for mood, anxiety, or insomnia. She would say, I'm able to fall asleep for 2 hours, then I'm up for 3 hours in the middle of the night. And finding herself like in those 3 hours needing to take an Ativan to help her fall back asleep.
Now, when she said not appreciating much difference after taking it for 4 nights, in your training experience, is that something that you would normally see with that type of medication?
Yes, I wasn't surprised by that.
And for something like mirtazapine, or what's referred to as Remeron, right?
Remeron, yeah.
What class of drug is that?
It is a noradrenergic specific serotonin antidepressant. So it's slightly different than an SSRI. It does work on serotonin. It also works on the noradrenergic part is alpha receptors, which is what those are the receptors that our body responds to adrenaline. So it should help kind of calm you down. And it also works on histamine receptors, which is why it can make people sleepy.
So for Remeron, the fact that it has a calming effect on somebody with anxiety, it's sometimes a good fit, right?
Correct, yeah.
And for somebody who might be complaining of sleep issues, it also has that secondary component that could help.
Yeah, it is a good choice for somebody who's having depression with prominent anxiety, insomnia, decreased appetite, because it can also increase appetite, which sometimes we want to happen.
And based on your review of her course of treatment with the clinic, those were issues that had arisen, right?
Mm-hmm. Yeah, I had noticed she had lost weight when she had gone to her PCP on October 20th. I believe she weighed like 130 pounds. On the 16th, when she went to the ED, she weighed 124 pounds, and they had done a pretty good medical workup on her with labs and everything. And she had reported like decreased appetite. So that was part of the clinical picture. And of course, not sleeping and very anxious.
Okay. And so with a medication like Remeron or mirtazapine, does it take time to work or to see results?
Yes.
And typically, what's the time frame for that drug?
I usually tell patients 4 to 6 weeks at a given dose is really going to give us a good idea of what that
Okay, so she's complaining of being tired, exhausted, and at the end of her rope now. What is giving her a drug that doesn't actually reach efficacy until 4 weeks from now? What in the fuck all is that going to do? I mean, I'm not trying to be a butthole here, but if she is complaining at being at the end of her tether and the human body does show signs of psychosis after 72 hours of no sleep, but she is effectively in REM deficit, in restorative sleep deficit, how is that? How in the foggy F is helping her in a month from and a half from now going to give her the restorative sleep that she desperately needs right now?
Dose is going to do. You may start to see improvements in the first 2 weeks, but full clinical benefit can take a month, sometimes 8 weeks even.
And you were aware prior to her coming to this follow-up appointment with you that she had been reporting after taking the Remeron feeling disoriented, forgetful, not feeling connected to the body, and anxious about whether she would actually sleep.
Correct.
And so were you aware that on November 28th that one of the nurses actually advised her to increase the Remeron?
I was.
And in addition to the medication, there was also the recommendation that she add some cognitive behavioral therapy to her treatment plan.
Yes.
And at that point on November 29th, by November 29th, were you aware of whether she had met with the social worker at the clinic?
She had not.
So did you have any indication that she had been engaging in some sort of cognitive behavioral or psychotherapy?
No.
Now, in relation to the medication piece of this follow-up, did you have any conversations with her about the concerns with the Remeron and what to do about that?
Yes, I did. I explained to her that it takes time to work, that it has only been 4 days. So I did encourage her to give it some more time. I also made additional recommendations as well.
Okay, and so what?
Okay, yeah. Okay, then riddle me this, Miss Smarty Pants. How is she supposed to sleep? Her brain won't shut off. What is she supposed to do besides holding her breath until she passes out and hoping that that will, I don't know, somehow equate to sleep? And I say this with the rage of someone that's told this, when I come to you as a doctor, I hate doctors. The fact that I am in your office is a cry for help. Yes, subtle though it may seem. But then when I say that I'm having these struggles, that I'm barely functioning in my life, and you say, okay, we can give you something, but it's not going to work for 6 to 8 weeks. Just white knuckle your way through it and talk to someone if you feel bad. The medicine might make you feel disconnected from your soul and, like you have to, I don't know, grab onto a counter so you don't lose your center of gravity. But in 4 to 6 weeks, you could feel better. I hope you feel seen for and cared today. And look, I get it. These are medicines that have to build up in the system. But then what are we supposed to do for patients that are acute right there, right then, that are struggling? Because I feel like there is a big gap there, and I don't know if there are medications that are on the horizon or more short-acting things that are just maybe more detrimental. But it is a little rich of medicine to give these pills, act like they're going to instantly work like a Tylenol, and then you tell the patient, well, duh, of course you're still feeling bad. It's going to take, another month and a half for this to even possibly work. And if it doesn't work, well, then we'll have to wean you down off of that one to wean you up on another one that will have to wait another 6 weeks. But in that in between titrating time, you might have the weird side effects from both of the medications and or interactions. May the odds ever in your favor. And that's how it sometimes feels like on the other side.
What were the recommendations for?
I had known that Julie had tried like 5 milligrams of Ambien. So I had suggested maybe we could try 10. Maybe we could try Ambien controlled release formulation because what because she was having these wake ups in the middle of the night, the controlled release, kind of like the outer layer gives you 60% of the dose, helps you sleep. Then throughout the night, the inner layer gives you 40% of the dose, keeps you asleep. I said that might be a good option while we're waiting for the Remeron to work. Because I was sort of thinking that maybe the underlying depression, anxiety was causing the poor sleep. So while we're treating that, let's try these alternatives.
Okay. And so was she receptive to the Ambien?
And, fair point on her. She was looking at acute or, PRN things that she could do. So, fair point on her that she did actually take the time to think about things that could work in the short term as they were waiting for the Remeron to kick in.
No.
And did she say why?
No, I don't recall.
Did she express to you that she had some other concerns about taking certain types of medications for sleep, like benzodiazepines?
She did.
What'd she say about that?
Was concerned about taking benzos. She had mentioned something called rebound anxiety. And what that is once the dose sort of wears off, your anxiety goes like above your baseline once the dose of a benzodiazepine wears off. It usually typically has to do with half-life of a medication. So for Ativan, that's usually between 8 and 24 hours. So if she's taking it in the middle of the night, the next morning she would feel more anxious. She was concerned about that. She also feels she was concerned about getting physically dependent on it because she had needed to take it for a number of nights.
And when she used the term rebound anxiety, was that her terminology?
Yes, it was.
And is that a terminology?
You mean a patient researched and was... So the patient did their part where they looked at the medication you suggested and then looked at the possible side effects, found a concern with one of the possible potential side effects and used the definition that was probably one of the concerns that you could Google. And now that's part of manipulation. Are you kidding me? So being a well-researched, good, patient that is trying to do their part and, be an informed patient about what they're putting in their body. Now this is manipulation. Oh, you and I would not be friends, ma'am.
That you generally use in psychiatric care to describe that, what you just told us about?
Yeah, it's a clinical term.
And was that something that she mentioned first, or did you mention?
I put it in quotes in my notes, so that's usually when a patient mentions it, I put it in quotes.
Okay. And so...
And this is not at all sinister. A person with a medical background is probably going to look and use clinical terminology. So while the Commonwealth may think that this is a smoking gun, I do not. I think this would be a way that any, nurse might look and might speak to another person in the medical profession. And I would have noted it only because that's part of how I document things, but it wouldn't have at all clocked up as manipulative or sort of out of anything that I would absolutely notice as being manipulative or something that would be out of the realm of possibility as a way that Lindsay, being an anxious, highly, type A person, would have communicated her feelings to a medical professional.
As far as the plan to address the sleep and to help her with...
I can't, y'all. Let's get to cross. Her voice is killing me. I'm sorry, you guys. I am sorry. It has been already too long a day for me to deal with her voice. Let's get to the cross. Please, dear Lord, let's get to the cross. Oh my God, how long is stupid Bo up there?
Time on December 15th.
All right, so we'll be in recess on this matter till around 2 o'clock, okay?
Oh, I thought we were getting to cross. I just needed some logic.
This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the 18 jurors.
All right, thank you, Madam Clerk. Mr. Reddington?
Thank you, Judge. Good afternoon.
Good afternoon.
Your Honor, just
Now, as a side note to our kind of coverage, Bob Mata has been in the courtroom the last couple days, and he says that nurse practitioner Gelada's civil attorney has been taking copious notes. She is in the courtroom, and I would not be shocked if the other medical professionals who were named in the civil lawsuit have also not had their own legal counsel as they are on the stand in the courtroom. And welcome.
a couple of housekeeping matters. I have the medical records from Women and Infants Hospital. I thought I offered that as an exhibit, but it's only marked for ID, so can I offer that now?
Commonwealth, any objection?
I have to mark them as exhibit 220.
Yeah, this just says Exhibit F though. That's why I usually mess up on those things.
There was another smaller packet that's not a binder that council offered yesterday that's been marked as exhibit 220.
There, it's up there.
Okay. All right, why don't we keep that marked for identification? If for some reason there's something different between exhibit 220 and the identification, we could enter it. Okay. All right, if you need to offer anything additional, just let me know.
Great, thank you. Thank you, Don. The other thing, Your Honor, that what I would ask is that there has been a lot of reference to the Diagnostic Statistical Manual 5 TR, especially as it relates to bipolar and related disorders. There's not an awful lot, but there's like probably 15 pages of single space typing, and it's really hard for people to absorb it. I'd like to offer that section of the DSM just as an exhibit, so if somebody wanted to look at it, they could.
I would object. We have witnesses to testify about that.
All right. Why don't we mark that for identification? I guess
that's my book, though. I need it.
Oh, I don't want to take away your book. We can readdress that.
Okay, sure.
In regards to that.
I would find as a juror, I would like to look at the DSM-5 myself. I know they have experts, but I've seen the people that you call as witnesses. I don't trust you and your, definition of what an expert is.
And if we're going to do it, it would just be portions of the.
Yes, we'll only do that one section.
But we'll see. Well, I'll give the Commonwealth the opportunity to be heard.
Okay, thank you. So you, in the course of your employment at the South Shore Health, is it?
Yes.
How many times did Lindsay meet with you?
Meet with me was 3.
And how many times did she meet with, does that include medical?
Yes, I saw her twice, telehealth once in person.
And do you know how many times that, you know that she had a psychiatrist that had been treating her since end of September, early October, right?
I knew that she had a psychiatrist that treated her in September.
And who was that?
Dr. Tufts.
And did you know that she continued to see Dr. Tufts through October, November, December, the same time that she was reaching out to you guys for help too?
I was aware she took the Zoloft in October. I was not aware she was still seeing Dr. Tufts in November. And I knew she called her in December.
You would agree with me that young woman came to you people for help, right?
Yes.
Okay. And she was very, very forthright. In other words, if you wanted her to sign a HIPAA form, she'd sign it, right?
Right.
And she would answer your questions to your perspective in an honest fashion.
Yes.
She didn't really hide anything.
Nope.
She told you all about the medications that she had been on and her fears and concerns about the medications, right?
Correct.
She described for you, as District Attorney brought out, what she felt her symptomology was, including suicidal ideation, worrying about suicide, feeling heavy, lethargic, you can't get out of bed, all of that stuff, right? Correct?
Correct.
And one of the things that you had left us with towards the end of your testimony is the fact that you were very willing, if you will, to work in tandem with other providers. In other words, you were concerned about being able to get information from other providers that had been dealing with her, treating her, right?
I'm not sure I understand the question.
Did you talk to Tufts?
No.
Did you ever get access to Tufts' medical records?
No.
Do you know how many times she saw Dr. Tufts?
I do not.
Would it surprise you if I told you that she saw Dr. Tufts 14 times in the time frame of October, or the end of September, October, November, December, and then January, 4 months?
Yes.
And that's 14 times plus the 3 that she saw you. Is that right?
Yes.
So that's 17 times that this young lady had access to healthcare providers for her mental health issues, correct?
Correct.
And that would be within a compressed period of time. I know it's the last week, I believe, in September, but October, November, December, and then January, right?
Yes.
And during that period of time, you're aware that she was provided many, many, many prescriptions for antipsychotics, selective serotonin reuptake inhibitors, benzodiazepines, all of that, right?
I'm aware she was prescribed other medications.
She was what?
Prescribed other medications.
Did you ask what other medications there were?
Yes.
And did she tell you?
Yes.
Did she tell you who prescribed them?
Yes.
It's pretty easy to get a list from CVS.
In fact, that's usually when they ask you medications, they usually ask who was the provider that prescribed that. Because this is when you have, so when we're young and healthy and don't have, really complex medical issues, it doesn't really, we have people put down supplements because there can be interactions between medications and supplements. And some supplements you can take too much of. So, that is important to look at. But as we age or as medical, histories and specialists come in, that's damn it, JKD Buck. Not taking a screenshot, but I might need it for future thingies, for a thumbnail or two. Download. Thank you for pointing that out. How did I miss that? I was trying to be all serious. It is very important to, and look, I'm no share or anything, but listen to Mama Mo in a sort of, angel person kind of thing. Your doctor needs to know who prescribed you what, and if you have a mind like me and you can't do it, just take screenshots, take photos of your medications, and have a list you've already printed out if you get fill out paper anxiety, that kind of thing. But do be honest and give your doctor a real picture of what you're going through. This is a partnership. This rebrand is really weird. 9 Hollywood 9. Oh shit, this is totally demonetized.
Right?
Yes.
And did you have any difficulty determining who was providing the prescription?
Away from the mic. This is entrapment. This is entrapment. Damn it. No, this is not fair. This is not fair. This is the YouTube gods trying to get me demonetized because they don't want to pay me. Stop. God, not the face. You guys, the face. I am dying here. Literally dying. I can't, you guys.
Prescriptions for all of these medications.
No.
And did you know that, in fact, it was Jennifer Tufts that prescribed the, Sertraline, September 15th of 2022. 30 count, 25 milligrams was Jennifer Tufts. You knew that?
I did.
You know that Jennifer Tufts on October 21st, 7 count of lorazepam. You know that?
I did.
And 5 days later, Jennifer Tufts prescribed on October 26th hydroxyzine, 25 milligrams with a 30 count. Did you know that?
I did not know that.
Did you know that on the same day, Tufts prescribed 30 count of lorazepam? Did you know that?
I would have known that. Yes.
I would-
Checking the PMP for controlled substances. Yes.
You do recall that you checked with it?
Yes.
When you download, do you download that information and kind of put it in the file? In the file?
No.
So is this your memory that you believe that you checked with PMP?
I do routinely check the PMP.
You might routinely check, but did you check?
Yes. Yes, I did.
You don't download it, you don't keep it with the medical records, right?
It's a box you can click in the medical record and you can check that you reviewed it.
Okay. Is it in your medical record that you reviewed it?
I'm not sure how it would have gotten printed out. It doesn't go into my note, but it is a box.
Look, All I need is one of the bunions to come by with a burlap bow on my face, laughing hysterically at Austrian painter jokes. I mean, legitimately, I have Admiral Akbar in my head going, "It's a tarp, it's a tarp. Disengage, Mo, disengage. This is not the day. Mo, step away. Step away from the meme. Step away from Grok. Step away from Grok, Mo. Someone call Mr. Mo and tell him to get down here." Okay, let's just we're only at DEF CON Mauve right now. Let's just continue. We can do this. We are functional adults.
That I would have
Press on
checked
the
it.
box in the computer?
Yes.
Okay. October 26th, buspirone, 5 milligrams, 30 count, same day by Tufts. You knew that?
Buspirone.
Yeah.
I was not sure that it was Dr. Tufts that had recommended the buspirone.
Okay, so if I suggest to you that the prescriptions that we have in evidence on the chart indicates that on October 26th, Dr. Tufts prescribed a 30 count of buspirone, would that either refresh your memory or would you accept that as being a medical history?
I would accept that.
And what is buspirone?
It is a medication used to treat anxiety.
Okay, and lorazepam, what is that?
Benzodiazepine.
And hydroxyzine, what is that?
It is an antihistamine medication.
And lorazepam, again, prescribed on October 21st as well as 26th by Tufts. That's the same thing you just told us what lorazepam is, right?
Yes.
Sertraline, of course, is Prozac, is that right?
Zoloft.
Prozac, they're both SSRIs, right?
Yes.
So from October
Weird to
21st
see
up
her
through
smiling with
November.
that particular microphone. Like, I never imagined that particular historical figure happy, and it's just weird to my brain is playing tricks because it's such a happy voice, and it's such a happy, like, face, and then the little mustache. I need a cloak. I can.
Ninth, she was prescribed all of this group of drugs until she saw a Kavon Izadapana, Izadpanah. Do you know who that person is?
They work in the emergency department at Social Health?
All right. And that would have been on November 16th when she went into the emergency department, right?
Yes.
Prescribed trazodone, 50 milligrams, right?
Yes.
And then she started to consult with your clinic around the 25th of November. That would be around Thanksgiving or so, correct? November 25?
I believe her first visit with Julia was November 21st.
Okay. So what I'm saying is that it was around that time in November that she started to consult with your clinic, correct?
Correct.
You know that she was referred to your clinic by her mother-in-law, Pat's mother, who was a labor and delivery nurse.
Yes, I am aware.
Referred her to Julie Paul, who kind of stepped in for a very short period of time to try to help out, right?
Yes.
And then Julie left, went to New Hampshire to continue her work, and you picked up on November 30th of 22. Is that right?
November 29th.
On November 30th of 22, you wrote a script for quetiapine, 30 count. Is that right?
Yes.
And what is quetiapine?
Seroquel.
You also, a week later, wrote a script for diazepam, 5 milligrams. Is that correct?
Correct.
And then the next day, you wrote a script for, December 6th, you wrote a script for diazepam, 5 milligrams, right?
Correct.
December 7th, you wrote a script for diazepam, 5 milligrams, right?
Correct.
December 7th, again, you wrote a script for quetiapine, 30 count, right?
JKD Buck, you have the meme powers. I'm not saying that is when we had Indiana Bones and the Revenge of the Cahoon, I think we have found our Cahoon. Basically, what I'm saying is, OBJK Debug, we need your meme help. You're our only hope. I
I would need to check my.
You can look at anything you want. If
Okay.
you have your records, feel free, please.
Okay. You said
Yeah, it would be
December.
December 7th. I'm looking at quetiapine, 30 count of 100 milligrams.
I don't believe it was a 30 count of 100 milligrams.
Do you remember writing quetiapine script for 100 milligrams?
I do. I believe the quantity was 22.
22. Okay. So on December 7th of 22, you wrote a script for quetiapine, and forgive me, I'm sorry, what is that again?
Seroquel.
Seroquel, for 100 milligrams, right?
Yes.
And why did you write the script on November 30th for quetiapine 25 milligrams and then about a week later increase it to 100 milligrams?
On November 30th, I had anticipated utilizing it over a 4-week course of treatment for sleep and anxiety. But her clinical symptoms, presentations changed, and we opted to use it for mood stabilization.
And who's we?
Me.
Okay. And were you working with anybody else?
is the person that you collaborated with in the room, do only you see them? Is that the we in the royal sense? Have you been talking to Jess Machado? Like, what is going on here? We've decided, I mean, because I know I say that because I genuinely do consult the different, personality modes in my head, and we all come to a consensus. So it is actually correct. But why in the world are we using the royal we? Stop. Unless you are inbred and have the flippers to prove it, then stop using the royal we. There's a lot of inbreeding that goes into, that privilege.
Any psychiatrists or anybody?
No.
So when a person comes to your clinic as a woman who has recently had a baby or is within that postpartum range of time and presents with the symptomology that she presented, is that something that would give you cause for concern? Suicidal ideation?
I in no way want to minimize what Lindsay experienced, but it's common for us to treat.
It's common to treat women in that
Yes.
fashion that are
That are
postpartum?
Postpartum who may have suicide. Oh,
Keeps cutting off the witness before she gives an answer. Make sure you complete her.
You keep picking bows that make you look like you, again, assaulted and robbed demonic dolls from, I don't know, a taxidermy shop. So, again, I won't point out your flaws. I mean, more than I already am. Leave Reddington alone. Broomhilda, hush, not your turn to talk.
Answer.
Sure. As I've said before, let's only talk one at a time. You finish your answer, and then we'll go to the question.
Go ahead.
her symptoms were serious, and it's not uncommon for me to treat women with serious symptoms in the postpartum period.
Okay. 2 days later, you prescribed 8 count 5 milligrams of diazepam. Is that right?
2 days from December 7th?
Yeah, it was December 9th.
December 9th. Yes,
4 days later, you prescribed more diazepam. Is that correct? December 13th?
correct. That would have been 2 milligrams?
Yes. And then jump ahead to December 19th, you prescribed 14 count 2 milligrams of diazepam. Is that correct?
Correct?
And then December 19th, you prescribed 300 milligrams of quetiapine, 30 count, right?
Correct.
And that was on December 19th. 3 days later, on December 21st, you prescribed additional quetiapine, 100 milligrams, 14 count, right?
Correct.
And then 1 day later, you prescribed more quetiapine, 25 milligrams of 14 count, right?
Correct.
As far as your prescriptions continued on, if we can jump ahead, you continued to treat her. And on January 13th, you prescribed 2 milligrams of diazepam, 7 count, right? That would be on January 13th.
I did not prescribe that on January 13th.
All right, if I suggest to you that Rebecca Gelada has a script for January 13th of diazepam, that doesn't refresh your memory?
Would it have been a script that I had sent previously that hadn't been filled at the original date?
Well, I believe the records would indicate that. We'll make a note of it. January 13th, diazepam. How about January 16th? Do you recall prescribing diazepam to her, 2 milligrams, 3 count?
No.
Diazepam on the 19th of January, 2 milligrams, 14 count?
No.
No? So you're not able to prescribe medications, or somebody else can't use your name, right?
Right.
And you have the DEA license to prescribe medications, correct?
Correct.
Now, one of the things that you went through was a lot of, obviously, it's a little confusing with the
No,
names
not
of the various
confusing,
drugs. And the
no.
district attorney said to you blithely, she said, well, she's
No, no, we were doing good on the wide shot. Damn you. Damn you.
a nurse, so she knows what those drug names mean. Do you recall that question?
I do.
Yeah. And you just said, yeah, right?
Mm-hmm.
So you're assuming that a woman who gets her RN at the age of 24 in a one-year program and then works for 7 years as a labor and delivery nurse is familiar with these names and what they are, what drugs they are?
She seemed to be familiar with them. Yes, she understood.
Right. Did you know that she was Googling 60, 70, 100 times a night what benzodiazepines are, what Seroquel is, what all of these medications are?
I did not know that.
Did you ever ask her where she acquired what appeared to be, apparently to you, her ability to know what these medications are?
I'm sorry, I don't understand the question.
Well, you wouldn't know the medications that a labor and delivery nurse uses when they're helping a woman who's giving birth, would you?
Not necessarily.
Okay. In any event, one of the things that you left us with is the fact that you were very, I think the word was invested in Lindsay Clancy and were concerned about her treatment, right?
Correct.
You knew that she had gone to the Rhode Island program for Women and Infants Center, Behavioral Health Day Program in Providence, Rhode Island. You knew that, right?
I did.
And you basically gave her the referral. You didn't make the referral. I think it was Latasha Dukes that might have done that.
Correct.
So you were aware of the fact that a recommendation was made to Lindsay that she reach out to someone else for help, right?
Lindsay made me aware of that, yes.
And she needed help, didn't she?
Yes,
And she went to Women's and Infants Hospital on December 20th, right?
she did.
And was she treated at Women and Infants?
I don't believe so.
Why not?
I wouldn't want to speculate or assume, but it seemed to be her intake appointment.
Or what?
Her intake appointment?
Okay. So without assuming or speculating, you referred her to this provider, right?
Yes,
So you have this woman who you know has been seeing Dr. Tufts, a psychiatrist, right?
right.
You knew that. You didn't get access to Tufts records. You didn't know what Tufts was doing, but you knew that for a period of time before she saw you, she was dealing with a psychiatrist, right?
Yes,
You knew that she was a woman who had just given birth like 5 months ago, right?
yes,
You knew that she was obviously in trouble. She was sick, right?
yes,
You told us that she was suffering from, and your words were, a mental health illness that was very real. And you told her that this will get better. And that was in December of 2022.
yes,
So when you referred her needing help to this women's and infants program in Rhode Island, and she went because that's what she was told to do, what happened at Women and Infants program?
I can't speak to what happened at Women and Infants
Why not?
because I was not a part of that assessment.
What does that mean?
I did not.
Reddington being the avatar of all of us right now. What the hell does all that you are covering your ass with just mean? You could have gotten a release and gotten access to what happened at Women's in Health and why that didn't work out from a clinical perspective through the notes. And you've already said on cross that Lindsay was cooperative. She was honest and open and forthright in your estimation. So, oh, ma'am, how are your barista skills?
See the assessment, and I did not speak with Dr. Diaz.
Why?
Lindsay had informed me that she was going to be at the program for 2 weeks.
She was hoping to be at the program for 2 weeks, right?
She told me she was going to be at the program for 2 weeks.
But she was turned away after about 8 hours of sitting there in an assessment and sitting in a group session. And she was turned away because of their concern that she was suffering from, well, let me ask you, what was their diagnosis?
I'm not sure.
Did you ever find out?
I have not.
Does it matter to you as a treating person that I think your words were is invested in Lindsay Clancy's care at that time? Did it matter to you why she didn't get accepted into the program?
It did.
Why was it?
I do not know their diagnosis.
Did you know that she had been diagnosed? You have different diagnoses, right? Like general anxiety disorder or general anxiety, GAD. And then you have, is it a differential? Is that what it's called?
Mm-hmm.
What does that
Yes. It means a differential in medicine could be patient comes in with a cough. What are your differentials? Differential might be bronchitis, pneumonia, strep throat. So it's different things, different diagnoses you consider.
Did you know that, in fact, they wouldn't accept her into the postpartum program because of their concern that she had been over-medicated by drugs, and they wanted to find out?
I can't speak to that.
Did you know that she was diagnosed as diagnosis depression due to adverse drug effects?
I cannot speak to that.
Do you know, invested as you were, that on December 20th, the very same day that she had finished being evaluated, woman you were invested in, had been evaluated by Dr. Diaz that you recommended or you mentioned, that in fact, looking at the exhibit, that they recommended tapering Seroquel, starting 200 milligrams tonight, follow up with outpatient provider of note. We attempted to reach current outpatient provider Rebecca Gelada, but did not receive a call back.
I never received a call from Women and Infants.
So this medical record from Women and Infants saying that they called Rebecca Gelada and never got a call back, your memory is that they never called you?
They never called me. I absolutely would have called them back.
Okay.
Mm-hmm.
Well, regardless, you never talked to anybody from Women and Infants, did you? Whether they called you or whether you reached out to them being invested?
I did not. I know our program re-referred her a few days later.
I'm going to offer this now. You want to, I think, just...
It's already in it.
we'll just,
Mark,
Shut up, Brumhilda.
yeah, we'll keep it as an exhibit for
Sit your
identification.
ass
You can
down.
double check, make sure the pages that have been referred here are contained within.
Broomhilda, not Reddington, but it was a little delayed.
Is it exhibit 220?
Yep.
And if not, then we can admit the second.
Okay, thank you. One of the things that is a takeaway from your treatment of Lindsay is that she was, I think your words were that she was scared and thought that starting these drugs, the drugs, it was scary, were her words, right?
Yes.
And at no time did it occur to you that Lindsay was doctor shopping or trying to get drugs. She was trying to basically get off drugs, right?
Correct.
One of the things that you had mentioned is that the Good Moms Have Scary Thoughts book is something that you guys would give out to women when they would come into your program.
Yes.
And hopefully it would be a good source for them to read things and maybe get some comfort from it, right?
Yes.
This is not, in your opinion, something that is indicative of like being a smoking gun.
No.
Police officer would seize it and the search warrant isn't.
No.
This is something you guys provide people to just help them out, right?
Yes. Yeah.
And just a couple of things. So on November 17th, she had an office visit with you. Is that correct?
Not on November 17th.
Okay. And the U.S. South Shore Medical Center, right?
Yes. That may have been her PCP.
Okay. Is that her PCP? Is that the person that would be under the umbrella of the South Shore Medical Center?
Yes.
Would that be Kimberly Tocchio?
Yes.
Okay. So you must have read Kimberly Tocchio's records, I would imagine, right?
Yes.
And you know that she was seen, record indicates that she was seen by a psychiatrist, and this would be November 17th, note, started Zoloft 25, which was then increased to 50 milligrams, right?
Yes.
And she took the Zoloft 50 milligrams for one night and was unable to sleep and was discontinued because of the effect that it had on her, right?
Yes.
Now, one of the things that you had mentioned is that it's important to determine, and you did have thoughts of possibility that she was bipolar. Is that correct?
Correct.
And one of the things that is contraindicated to someone who does suffer from bipolar, whether it's 1 or bipolar 2, is that you do not place them on a selective serotonin reuptake inhibitor drug, such as Prozac or Zoloft, right?
Correct.
Because it can have an effect on them. Isn't that right?
Correct.
And what's the effect it can have on them?
It can cause what we consider rapid cycling, meaning you can swing from mania symptoms to depression symptoms relatively rapidly.
On November 21st, did she have a meeting with you all? if you recall, looking at the records, did she meet with Julie Paul? If you
Yeah,
know?
yes,
And she gave Julie a history of what she had been going through. Is that correct?
correct.
And in that history and in her talks with Julie, she had disclosed the fact that one of the things that she did in November was took a marijuana gummy, one gummy to try to sleep, right?
Correct.
And again, her medical tests, blood tests, urine tests, everything showed that she had no alcohol, no THC, nothing on board, but she still disclosed the fact that to try to get some sleep, she took one gummy in November, right?
Yes,
So again, she's reporting, trying to be honest with you people as a provider, correct?
yes,
And the scales that counsel asked you about, you were talking about the depression scale, you were talking about the Edinburgh scale, and I think we all know that the Edinburgh scale is geared for an evaluation of a person, of a woman who is in that postpartum period, and you evaluate whether or not they are, as a result of being postpartum, severely depressed, right?
yes,
And you indicated that at some point her Edinburgh scale was initially, what was it, 15, 17, if you know?
initially at my visit, my first initial with her,
Yeah, what was her Edinburgh scale the first time you saw her?
17,
Okay. And that would be moderate?
moderate,
Okay. And then she had another Edinburgh scale after that, correct?
correct.
And when was that, if you know?
December 6th.
And what is EPDS? What does that mean?
Edinburgh postpartum depression scale.
All right. So would you look at November 21st, please, which would be, so November 21st, she was administered a Edinburgh test, right?
On the 21st. That would have been at Julie's appointment. I don't have that in front of me.
If I told you that, well, on November 21st, it's a short period.
And that's not an excuse. They work in tandem, so the psychiatrist should be, again, taking into all of her evaluation information of what is going on in other visits. So she should be reading the notes in the intervening time between appointments. If Lindsay has gone to another professional within the clinic, that she told her to go to, this should be something that she's aware of.
Time after November 17th. Did they, whether it's Julie or somebody else, administer an Edinburgh test to her?
Yes,
And what was the result?
23.
That's severely depressed, isn't it?
Yes,
So
Holy crap, your face is severely depressed. I'm sorry, I'm fascinated by all the things. Basically, she's watching her career burn down right in front of her, but watching her face react to it in time is fascinating. And look, I have no chill for this woman because this woman decided to do F all and other than say and wear the bow of, I am so invested, the invested bow, instead of actually doing her GD job. 3 children are no longer on this earth, and I get that it's multifactorial, but the fact that we all sit here and after looking and listening to nurse practitioner Paul have the heartbreaking realization that if anyone had just given half a damn, this wouldn't have happened. So I'm watching her face break in real time again. Actually, I'm slowing it down. I think we'll go 75. All right, just for my personal amusement. Oh. Yes, that was that right there when you were looking down, that is where your career will be after this. Thank you for indulging me. Sometimes we have to engage in a little schadenfreude. It's the only thing that gets us through these trials. No, there was no sound. I wanted to see her face break in real time.
6 days, she decompensated from Edinburgh scale 17 to Edinburgh scale 23, right?
so she was 23 on November 21st
Right.
and 17 on November 29th.
Okay. So when you see a patient that's come to you and has an Edinburgh scale of 23 and an Edinburgh scale a couple of days later, that would be, what was it?
17.
And what was it when you first saw it? You referenced it before, 17?
17.
Yeah, that's still pretty high, isn't it?
It's high, yes.
Would that give you pause in conjunction with the symptomology that she's referring to and self-reporting, what she's feeling? I mean, the fact that she has a 23 on the Edinburgh scale, which is very high, and then followed up a couple of days later by a 17, taken in conjunction with what she was saying her symptoms were. That's of a concern, isn't it?
Yes.
So on November 20th, which would be the day before, that Edinburgh scale of 23, and the jury will have access to all these records, she was reporting struggling with postpartum anxiety, right?
I can't speak to
Okay,
that.
that's fair enough. We'll go to when you treated her.
Yes.
Did you have a chance to review Julie's notes at all?
I did.
Okay.
Yeah.
And when was the first time that you actually met with Lindsay?
November 29th.
Okay. Which would have been after Thanksgiving, obviously, right?
Yes.
And you would have reviewed the records up to that point, right?
Yes.
So one of the things that you would have reviewed was what she had indicated or reported to Nicole Harden Francis. Do you know her?
Yes.
And who's Nicole Harden Francis?
She's the nurse at our program.
All right. And this would be on November 28th that she was speaking with Nicole, the nurse. You read the report before you met with Lindsay on the 29th, right?
Right.
So you knew that she had been reporting panic symptoms, that she was disoriented, that she was forgetful, that she was not connected to her body. Is what she told her, right?
I would have to review that just to be accurate.
What? Here's another curious thing for this practitioner and Julia or Jennifer Tufts. They both diagnosed her with generalized anxiety and major depressive disorders, but they did not put the precursor or the addendum of postpartum. It's almost like they were avoiding the use or the billing code or the diagnosis of postpartum for some reason in Lindsay's case. And I don't know if that has to do with insurance or what have you. So I don't want to attribute sinister connotations that are speculative, that I don't about, a system I don't understand. I don't want to assign malice for something that may be procedural, but it has struck me as curious that at least those two practitioners diagnosed generalized anxiety disorder, but failed to clearly label that Lindsay was in, a postpartum, time period. So I don't know if there are different criteria that you absolutely must meet to get a postpartum depression, clinical diagnosis. Those are the intricacies that I don't know. So I don't want to assign, incompetence or malice where it might be a function of a system I don't understand.
That's correct.
Okay. And would you agree with me that symptomology of mania, especially when incurred or encountered by a woman within the postpartum period, that's one of the symptoms, is being disoriented, right?
Not necessarily.
How about maybe a little bit?
Could be confused if you're manic.
Yeah. How about forgetful? That's an issue, isn't it?
Not necessarily a symptom of mania.
Okay. How about not connected to her body? What does that mean?
I'm not sure what that means.
So if you have a patient who's coming to see you, who's indicated the day before that she has the panic symptoms, disoriented, forgetful, not connected to her body, wouldn't you ask her what she meant by that?
Yes.
Okay. So when you saw her on November 29th, you diagnosed that she had postpartum anxiety, right?
Mm-hmm.
Adjustment insomnia, right?
Correct.
And when you met with her, you noted that over the last 2 weeks, you asked her about how she had been feeling, and she said she was feeling nervous, anxious, and on edge. She said nearly every day, right? That's November 29th? That would be under screenings.
Yes, she was.
I would give you a page number, but they don't give us page numbers. She told you, and you can pull it up if you have it there, that she was not able to stop or control worrying, and that had been for several days at least, right?
Correct.
And she was worrying and stressing about things, worrying about different things every day, right?
Nearly every day, yes.
Couldn't relax nearly every day. This is a questionnaire form that you had, right?
Yes.
Being so restless nearly every day, correct?
Correct.
Asked if she was annoyed or irritable, and she said not at all. Sure, like she didn't believe that she was a person that would be irritable or angry with people, right?
Yes.
And then feeling afraid, as if something awful might happen, and she got that GAD 7 score of 14. Is that correct?
Correct.
So what does a GAD score of 14 tell you on November 29th?
Moderate anxiety.
And then you ask about in the last 7 days, trying to get a history. She denied, definitely not so much now, that she was able to laugh or see the funny side of things, right?
Right.
And that she was asked, is she looking forward with enjoyment to things? And she responded, hardly at all, right?
Yes.
Blaming herself when things go wrong. She says, yeah, some of the time. Yep.
Yes.
Anxious and worried for no good reason. Yes, correct.
Yes.
Scared and panicky for no good reason. Yes, correct.
Yes.
Thank you for becoming a member, Rogue Mama. Love it, love it. Welcome to the Church of Mo. I endeavored to start off this week much more, on top of members only content. And then this week happened, and the fronts from hell have been going through, and my body's like, nope. Remember all of that motivation you had? It is now, is it Wednesday or Thursday? Wednesday. It is now Wednesday. That has all gone. Your health bar is at 0.
Asked if she felt sad or miserable, if she was a miserable person, and she said, no, not at all, right?
Right.
Did she indicate that on that day you gave her the EPDS Edinburgh test, and she had an Edinburgh score, as we said, of 17, right?
Yes.
All right. And then
Mr. Mo and I were talking about this because it's going to sound dumb, but take this weekend. I had been thinking about getting noise canceling headset for a while. And by the time I had already done all that internal, okay, can you get away without getting, the fanciest set? Do we actually need this? Is this something that, can wait until everything goes on sale? And then we get to Best Buy, and because I think that I have appropriately explained that I am very close to the end of my rope, with the subtlety of asking for help, I feel like I have communicated, okay, let's get these today. What Mr. Mo thought was, we are going to go try these all on. I'm going to continue research. And, we want to make the right decision if we're going to invest in an expensive equipment piece. So because my way of communicating distress is so completely subtle and almost under the radar, it wasn't until I melted down in Sam's Club that, when I was finally able to look back, I said, because the nature of what I thought the visit was going to be at Best Buy changed, and for good reasons. Mr. Mo's reasons all made sense, and it turned out okay. But because my expectation had been that I was going to be getting headsets, it's kind of how Lindsay felt with her medications. You go into the doctor, you are at the very end of your rope, and the doctor says, okay, here's the medicine. And you're like, okay, I am doing something proactive. I will feel better. And most doctors have been very realistic with me, about how long these things take to kind of get in. And while you can logic it here, maybe if you're like me, you take pill, you should feel better. My brain is still somewhat stuck there. Even though I know logically, scientifically, medically, that's not going to happen. And thank you, Jason J. Oh no, I did get a set of headsets, and these are really nice. So when I'm crafting, oh God, where is the microphone? Oh, see, so it has this little hidden microphone, and it is awesome. So I can wear them out, and then, but they are terrifying to me because they have their own little, y'all. I was trying to ride the line between knowing my technology capabilities and then realizing that for comfort, I'm going to have to go with, so it comes with its own little mixing dealy. I am having Mr. Mo diligently read the instructions so I know how to deal with this thingy mabob. But it also charges the battery too. So I was like, I don't know. They're wireless. They're very comfy. And they will work in the way that once I am not intimidated by this doodad. Um, uh, and so once I get not intimidated by this doodad, we will be having snarks and craft, you guys. Legitimately, I know we are on the side quest of side tangents, but you were warned at the beginning of this tangent-y ride. I am legitimately having so much fun and such an outlet with our with my bows of discontent idea that I am so excited to hopefully this weekend, if we can get all caught up and that kind of jazz, to do some snarks and craft stream. I know the craft channel has kind of gone by the wayside. I am learning that when dealing with a really, really heavy case like this, I can tend to even be overwhelmed by crafting. So I'm trying to just be okay with this. And right now, the bows of our discontent are sparking creative joy or whatever it is that chick says you should hold on to. So I do intend to do that. It's part of my personality that I feel I've been neglecting for a while, and I think maybe that's put me more on edge too because it's one of my stress relieves things. But I've also been just so emotionally drained at the end of the day because this case is hard, and it's bringing up a lot of feelings that I wasn't. I I didn't think I was going to be dealing with, just about this trial. I knew it was going to be hard in the sense that this is just tragic, but then to have Lindsay's experience mirrored in many of our own, with interactions with clinicians, it's been a very raw trial, and I don't think that there's anything wrong with that, but it definitely means that we have to go by our own pace.
The medications that you prescribed to her, we've already got an evidence. The jury will be able to look at the actual scripts in the exhibit without going through every single day. The next her was November 30th. Is that right?
I messaged with her on November 30th, yes.
Okay. And you indicated that if you're not sleeping well with Valium, no need to continue it. I'll prescribe a short taper. And you went on about tapering and 5 milligrams of Valium to 2.5 milligrams and no benzos. And
That was not on November 30th.
okay. Does it say on the record? Are you looking where it says patient message in the perinatal behavioral health program of South Shore Health, November 30, 2022?
Yes, I'm looking at the messages.
Okay. So is it a different date that you sent that message? It says November 30th on it, right? I just don't know internally if you guys have different.
Oh, I understand. Oh, at the top it says November 30th. More specific, it'll say the dates, but the header will say November 30th. So I understand.
Okay. And basically you indicated that you were going to send along information about bipolar 1 or bipolar 2, which actually would be what's known as a bipolar spectrum disorder. Is that correct?
Yes, that was on December 7th.
Okay, but it's underneath November 30th, so forgive me for looking at it that way.
Yeah, I don't know why.
That's all right, no problem. So one of the things with the mania that you refer to and that you talk about is excessive activity. Is that it? Excessive cleaning sometimes, right?
Sometimes.
Excessive exercise.
Sometimes.
Did you know that after she had Callan, that within a matter of a couple of weeks that she ran a 5K?
No, I did not know that.
and that nobody wanted her to, including Pat, but she just had to get out there and run and did.
Objection.
Overruled.
You know that?
I did not.
Is that something that would be important to know? I mean, as far as whether or not a person is in that manic stage where it's post-delivery, and that's a significant artifact, if you will, of exercising, right?
It would have been something I would have considered.
Okay. And as I said, you were pretty much the only one that actually considered bipolar spectrum disorder of all the doctors that she had seen. You know that, right? Are you aware of that? All right, never mind. That's right. She's going to object. That's okay.
Okay.
So the symptoms that you noted were
Oh my God. I do this all the time. I'm like, okay, look, let me continue with my monologue. Anyways, she was babbling, Your Honor.
mania. It says mania characterized by exaggerated excitement, hyperactivity, and racing scattered thoughts, right?
Yeah.
So what is, go ahead.
Was that from my note?
I'm looking at the same thing that we've been looking at, which is,
Oh, the information I sent her on bipolar.
yeah, it says,
Yes.
hi, Lindsay, and then your note, right?
Mhm.
Your Honor, if I may suggest maybe showing the witness what he's referring to.
She has it in front of her.
I think I understand what he's referencing, but thank you.
If the witness has a problem,
The fact that the witness is both a doctor of medical science and then has additional training in psychiatry and can't figure out basic reading comprehension terrifies the ever-living hell out of me. And the fact that the Commonwealth is trying to cover for the fact that they're the bailiff, you, sir, are going on the thumbnail. You encapsulate every bit of our feelings about this trial. Sir, same. Sir, same. Oh my God. You know what? I would him as look, of all the Disney princesses that resemble me, Lilo is definitely the one that I am, and I would wear a t-shirt of him memified as my spirit animal, my current social energy level, my current energy level, and just a cartoonified of this man just like this. Okay. I mean it. I mean it in full love, sir. I would wear a t-shirt.
in regards to that, you need to look at some, just let me know.
Okay.
All right.
Thank you.
Thank you. If you move ahead to, I think the message portal or whatever it's called, on November 30th, it's captioned "Stopping Remeron." And
Yes.
okay, you're with me. And it says, no, this would go to the fact that she was still not sleeping. It was a huge problem for her, right?
Yes.
And she told you in her message thing, no, the weird thing is I don't feel tired at all.
Correct.
And that's one of the things that you had told us earlier is a symptom, correct?
Correct.
A person that is not getting sleep but doesn't feel tired.
Correct.
What is a symptom of?
It's a symptom of mania that we look for.
Okay. And when we looked for that mania, did you notice that? And did you factor that into your diagnosis?
Yes.
Okay. How many times, if you recall, did Pat come with his wife to meet with you? Was it 3?
He came to a visit once. I believe I spoke with him and Lindsay on the phone twice.
Would you agree with me that, as counsel asked, did he get permission to be there? And you indicated no, that you would welcome the third-party contact.
Why is your thinking face this? Are you aware that that's your thinking face? I mean, I am genuinely curious. People and their facial movements fascinate the hell out of me because it's the weirdest thinking face I've ever seen, and I've seen a lot of them. I study people. You deeply fascinate me. Notice how in that statement is the inherent assumption that I am not human. How did I get this far in life without asking for an evaluation?
Right?
Correct.
And did it appear to you that he was very, very invested in her care and was very scared and worried?
Yes.
And he was complaining about the fact that he believed, or they believed, that she was being over-medicated, right?
I believe he was concerned about her symptoms. He felt that they started once she started being medicated initially.
Right, because she indicated that when she first started taking the SSRI back in October, I believe, that she ended up having it increased
Mhm.
and then had a period of almost 2 days where there was no sleep whatsoever. That was one of the instances, right?
Yes.
She also, counsel had asked you, and you did not recall her saying horrible intrusive thoughts. So if you would just look at November 30th patient message. It says, "Hi, Rebecca." And then it begins, "I don't expect you to answer this until Monday."
I see that.
Okay. And then she says how she basically only slept for about 4 hours at the beginning of the night, 9:30, and then dozed off for 45 minutes and said, "Today, all day, I had horrible intrusive thoughts and deeply depressed," right?
Yes.
So when was the next time that you saw her after she sent that message on November 30th?
I would have seen her on December 6th. She had sent this message, I believe, on December 3rd, and I saw her on the 6th.
So on December 3rd, and again, it would be the way that they print this thing out. It has a date of November 30th, but then underneath it, it would be a different date of December 3rd. Is that right?
Yes.
Okay. And when you, as an invested nurse practitioner, receive a message,
Do not give people, aka me, uh, any word that I can use as a cudgel to beat you over the head with, especially if it's a hip. Because normally I don't, but when you are a hypocrite, uh, do not give me a word like, just involved, concerned, and you show none of that. That is going to irritate me. I, unlike this woman, have a deep respect for what words mean.
from a woman who is postpartum, who has been through what she's been through and the symptomology that she explained and the doctors that she's seen, not to very good results, you'd be concerned when you see a person saying, "I have horrible intrusive thoughts," right?
Yes.
All right. So as a result of seeing on December 3rd that Lindsay Clancy, with her history, had been telling you that she had horrible intrusive thoughts, what did you do? Did you call her?
She had told me that she took the Ativan and now the thoughts were gone and she had felt good.
So,
But I did
Bro.
speak to her about it.
yeah, but she told you
At her
that
next appointment.
she told you that in her message,
Right.
that she had today, all day, I had horrible intrusive thoughts, deeply depressed. I finally took 0.5 of Ativan at 6 p.m. And the thoughts are gone, is what she told you, right?
Yes.
Did you ever bother to ask? I don't know. I mean, would you ask the patient what the horrible intrusive thoughts were?
I would have, yes.
Did you?
Yes.
What did she say?
She described them as thoughts of not wanting to be here.
How about, did she ever describe to you that she was hearing voices?
No.
How many people have you treated for postpartum psychosis?
5.
And of those 5 people, did they hear voices?
Some
Not all of them.
Mike.
How about some of them?
Some of them.
Oh,
And that's a real thing, isn't it?
it?
Yes.
And visual hallucinations likewise?
Not all.
So with the voices, that would be an auditory hallucination.
Yes.
Visual hallucination, not all, but some.
Hmm. Yes.
And that's a real thing.
Yes.
So when she
Oh no, someone learned that they lost Stalingrad. It's been a rough day in the bunker. God dang it. What do you mean we lost Stalingrad?
had horrible intrusive thoughts, did she say where these happened? Like, was she in the yard? Was she in a car? Did you ask her where and what? Or was it just that she just didn't want to be here anymore?
It was more that she didn't want to be here anymore.
Okay, did you ask her what that meant?
I did ask her if she had any plans or intent for suicide, which changed at different times during our treatment.
So on December 2nd, you have received you sent a note to Lindsay and said it, meaning what she was telling you in a prior communication, it sounds more like depression than side effects. That would be of drugs, right?
Correct.
It is not uncommon for me to hear, and then you quote, I have never felt anything like this before, end quote, or quote, I just don't feel like myself. All of this sounds like postpartum depression. Is that correct?
Correct.
All right. So she was expressing all of the symptomology of depression, what you believe would have been side effects, and you indicated that at this point, while you're working through it, this sounds like postpartum depression, right?
Correct.
And what would the symptomology of, what does postpartum depression mean, and what is its effect on a patient?
Postpartum depression is like depression at any time during a patient's life. However, there are some unique considerations. It typically occurs in the first 3 months after a person has a baby, but it can happen at any point in the first year. The considerations that are a little bit different than regular major depressive disorder are that there are significant hormone fluctuations that a person undergoes when they deliver a baby. Sometimes they breastfeed and they wean from breastfeeding, and that can set off additional hormone shifts. And it tends to be a very anxious presentation, and obsessive thoughts can occur.
Holy crap, you are supposed to be an expert in this. This should be your daily rote answer. You should be so adept at this. Like, how when you first start streaming and you're like, "Oh my gosh, how is Mo so good at when people rate in having a 5-minute or 2-minute little spiel about where we are in the case and, kind of to orient them." Well, that's because I've done it a lot. So the fact that she is so bad at explaining what exactly her practice is about is very telling in her comfort with this. This might be the very reason that she did not diagnose postpartum depression, because it's not her area of expertise. Sh- are we getting to the point where we're going to find out that she really has no background for I know I shouldn't have fast forwarded, but I couldn't deal with her anymore. I'll have to go back and read, but she very much doesn't seem to understand the mechanisms, or at least doesn't have a way to clearly explain them to a person in a way they could understand. And I find that baffling, as that should be one of her main jobs, is explaining to anxious young mothers exactly what they're going through. And, if this is postpartum depression, this is what it is. This is how it could be caused. We don't quite know, but we think a lot of hormones are involved. So, there should be a sort of natural ease that she has with explaining this to a layperson. And the fact that she doesn't have it is very, very concerning to me. That if she in fact is still taking care of postpartum women.
With greater regularity in postpartum depression than they would with major depression outside of the postpartum period.
So as a result of this information, you prescribed medication to her?
After I sent her the information on the postpartum, would this still be December 2nd?
Looking at the form that you have, it would be, yes, but I don't know if it's another date that there's a message underneath it. So let's look at the record where it says that on December 7th.
7th,
Yes.
okay.
And that's where you talked about bipolar spectrum disorder, right?
Yes.
And that's where you talked about how people would have these feelings of goal-directed activity, overly talkative, racing thoughts, need for sleep, things of that nature, right?
Yes.
What was the end result of that? Did you prescribe medication for her?
I did.
And what was it?
Seroquel.
One of the things that you had mentioned is that you provided a mood chart, I think. Is that what you said, a mood chart? Is this it? Is that an indication just so the jurors know that it's in the records?
Sticky Widget, I still believe, and I believe I can present a valid argument that magic might be involved if you cast perception on the director to find, the tone and exact, kind of words that her mom used when she was very disappointed in her to be a distraction. I, as a third-party intervener for the personality known as Molinda Moonshine, believe that that should be taken under advisement in our D&D session.
Horrible.
That looks accurate, yes.
Yeah. Yeah, there it is, right there. See on the very top, it says mood chart? Left?
Yes.
All right, and on the top, it says daily mood chart. And then you also provided another chart on that date. What is that? That's another variation of it?
It's the weekly mood chart.
Okay. So did you tell her to fill this out?
I suggested that she fill it out so we could keep track of her symptoms.
Okay. Do you remember if she filled it out when she spoke to you?
She did not speak to me about filling it out. After that, she did say she printed it out.
Okay. Did you ever ask to see it?
I don't recall.
Okay. On December 1st, you met with her, is that right? Oh, no, wait a minute, Christine Zappi. Who's Christina Zappi?
I believe she's also someone that works at Social Medical Center.
All right, do you know that she saw Christine Zappi on December 1st? Christina, I'm sorry, it says Christina.
I'm not sure if she saw her for a visit that day.
Okay. Have you seen in the pool of records that you have that she did see this individual and noted that she had been dealing with the problems, the insomnia symptomology, for over a month and a half, and medications keep changing, and it doesn't seem like much is helping. Did you ever see that?
That does sound familiar.
Okay, so she was somewhat in, this is almost hand in glove with saying, I'm not being heard, right?
Yes.
Idea. Did you see her on December 2nd, the next day?
I spoke to her on December 2nd.
Okay. And again, the district attorney kept asking you about, she had the opportunity to come in and see you if she wanted to, and things of that nature, right?
Yes.
And would you agree with me that it's sometimes better to have a face-to-face actual meeting with a patient rather than just on the computer?
Yes.
Did you ever, if you recall, with all of the symptomology and deterioration going by week after week, say to her, I really think that we should get together in person?
Yes. So we met in person on the 6th, and our plan had been to meet in person on the 13th.
Okay, so that would be December 6th, correct?
Mm-hmm. Yes.
Now, December 2nd, you had a conversation with her on the phone, is that right?
I believe it was just my chart messages.
Okay, so you see on where it says, again, it's got the big black letters, December 2nd, 22, and then underneath it, it says behavioral health history. Can you find that on your records? If you don't, that's fine. That would be the time that she indicated that she had been to the ER for anxiety symptoms as well as insomnia and heart palpitations. You remember that?
Check and check.
I don't see that.
Okay, well, then let's get it. Do you have access to other staff notes and records, right?
I do. I only brought my own.
Okay,
with me.
that
Yeah.
answers that. So if I approach you,
Yes.
Can I see when you're showing her first? Sorry.
sure. Okay. Yeah. Latasha Dukes. Who's Latasha Dukes?
Letitia Dukes was a clinician at our program at the time.
All right. So am I looking at Latisha Dukes, MSW? What does that mean?
Master of Social Work.
All right. And does that indicate a date that Ms. Dukes was?
December 2nd.
And on December 2nd, again, she was complaining of symptomology. She meaning Lindsay having heart palpitations, right?
She's describing that she had heart palpitations and she went to the ER for anxiety symptoms.
Okay, so the answer is yes.
Yes.
Okay, so
Yes.
And then she then went to the ER, and for a patient's report, she has an addiction to Ativan, and that's why she can't sleep. And she also noted had weight loss, right?
Correct.
And panic attacks, right?
Correct.
So she's got a fear that she's on the benzodiazepines by script that she didn't want to be on, and she couldn't sleep, and she was losing weight, and all the other symptomology that we talked about, right?
Correct.
And that's in December.
Yes.
December 5, Nicole Hayden-Francis had a chance to speak with Lindsay. And at that point, there was a recommendation that she might want to try INPT LOC. What does that mean?
Inpatient level of care.
Okay. And that would be Nicole Hayden-Francis, who's a nurse, was telling her that on December 5.
Yes.
Now, and again, I know you don't have the records for Letitia Dukes, so if I may approach.
You may.
On December 5, and you correct me if I'm reading this wrong, this would be Letitia Dukes, December 5, right?
Correct.
And on that occasion, Letitia Dukes notes that she called Aspire Crisis Support, she meaning Lindsay, right?
Yes.
What is Aspire Crisis Support?
Aspire is the community mental health program that operates the local 24-hour emergency services program for psychiatric emergency services.
Okay, so when I say you collectively, I mean psychiatrists, nurse practitioners, RNs from in the psychiatric world, tell patients that are in crisis.
Yeah, Jen, the couch fairy. I remember after one of my boys, I had hyperthyroid. I'd had everything except the weight loss, to the point. Okay, this is probably like, look, I felt like a jackass, but I'd much rather someone be honest with me and blurt out the uncomfortable thing. But my thyroid was, completely off the chart, and I had everything except the weight loss, to the point that they sent me to an endocrinologist who came in, took one look at me, and it was this little older Indian man, and he's like, "But you are fat." And I about died laughing because I said, "That's what I said too." Like, of all the things to get and I don't get the one superpower I need. But the heart palpitations suck, the sweating, the disorientation, um, all of the other things suck, uh, but, definitely gotta love just a doctor who's gonna tell you like it is. I mean, I too was baffled by my body's inability to do, the one time I should have been hormonally unable to be fat. And yet my body struggled on through. My body was like, "Challenge accepted, MFer." And it was like, "No, we are built for famine. I don't care what you say, thyroid." So I wish eh, actually, my doctor is gonna check my thyroid because I have been losing weight here lately, but I think it's just because I'm tired. I don't know. I mean, I was like, "That's never a symptom I will be upset about." And he's like, "Yeah, I'm still gonna check your blood." And I was like, "No, I like I said, that is never a symptom I want to check out." And he's like, "Well, how about you let me be the doctor?" And I was like, "Well, okay, we'll try that for a change."
And if you feel that you're going to have suicidal ideation or anything, you should call these numbers, what your people will give them, right?
Yes.
She called Aspire Crisis Support, not once but twice, right? If you know.
I'm aware of that one time she called.
Okay. But she was not given any help at all by Aspire, whoever they are, right?
I'm not aware of that.
Well, it says right in the records from Letitia that she met with an Aspire clinician virtually and was told that she did not meet the criteria for inpatient treatment due to not having an SI plan. What does that mean? They just told her, you're not laying on the ground with your throat cut, so we're not going to be able to help you?
Can't speak to what they told her.
So Aspire then recommended that she start or go to a day program. Is that correct?
That's correct.
And the clinician said,
I shouldn't be muted anymore. I do mute on and off if I'm gonna take a drink or something because those kinda sounds do bother me, and I'm trying to be more sensitive to that, or, if I'm going to, vape, this one's a bit louder, so again, but I should be noised.
that he, from Aspire, would be sending the patient resources, right?
Correct.
But they never did they? If you know.
I don't know.
Further, Letitia notes that they review the sleep hygiene with the patient. Clinician provided patient suggestions for meditation, grounding, self-soothing techniques. What's a self-soothing technique? You know,
It might just be simple strategies to soothe yourself using any of your five senses.
and she notes, and again,
No offense, but, that's the equivalent of telling someone who is having an arterial bleed, "Have you tried box breathing?" And I get the point because grounding does work. I mean, I'm playing with Century's toys right now because I'm so irritated with this woman's everything. Um, the other problem I'm realizing, and I don't realize I do this, but, when I'm deeply focused on a trial or something, um, and before Mr. Mo went to do school, he would come in and say like, "Oh, let's get some food or something." Well, unless I have a silent alarm on my phone, I haven't been doing that. So, uh, definitely just something that I need to do better on or better with. So, definitely, a total user error on my part, but, uh, trying to find things that taste okay and all of that, is hard for me. So, It's not unusual for me to kind of fluctuate a little bit in the last couple years. But I'm glad that this doctor is at least keeping an eye on it and making sure it's not just my weirdness.
And this is on December 5th. That Pat, patient's husband, joined the visit, reporting that her anxiety had become significantly worse since starting the psychiatric medications. That's it.
That is what that says.
And in fact, when you spoke to Pat, he had told you that, in his quotation, his words would be, it was 10,000 times worse since she started this medication, right? If you know.
I don't recall him using that phrase.
But he was upset about the medication, wasn't he?
I would say he was concerned.
Do you recall that he said that you're turning her into a zombie?
I do not recall that he said that.
So would you say to the jury that he was concerned or he was pissed off about the medication and what it was doing to his wife?
Objection, that's an answer.
No, overall.
I would say he was concerned.
Concerned? Okay. Did anybody address his concerns?
That day,
Any day.
I would say that day, I collaborated with them to take her off certain medications.
Okay. December 6th, you had a meeting with her. Is that correct?
Correct.
Again, she's diagnosed postpartum anxiety, right?
Correct.
Her EPDS score, as a result of being administered, the Edinburgh test was at that time a 21, right? That would be underneath office visit and perinatal behavioral health, above assessment and recommendations.
Correct.
And 21, how would you grade that?
Severe.
Severe what?
Severe signs of postpartum depression.
So you know that she had lost over 15 pounds by that point?
I was aware she had lost some weight. I was not aware that it was 15 pounds.
Okay. So then there was another patient message on December 7th where she again was expressing concern about the drugs, and you indicated, either way, I continue to recommend the Valium taper, right?
Correct.
There was a period of time that she indicated that she wanted to get off the medication and get off the drugs, and you indicated, as you told us, that you were on vacation that week, right?
Yes.
You basically told her to tough it out and just hit me up when I come back from vacation, right?
No.
Did you tell her to call you when you came back from vacation?
No, I asked that she try to hold off and wait for me to come back from vacation for the taper. She had wanted to taper it sooner.
All right. Do you have somebody that covers for you if you're on vacation?
Yes.
Did somebody cover?
She said that she was going to follow up with her other psychiatrist for the taper, but she did reach out to our program while I was on vacation.
Or I couldn't understand you.
I'm sorry. I know that she said that she had an appointment with her psychiatrist who would do work on the taper with her. And I do know that she was in contact with other providers at our program, including Letitia Dukes, while I was on vacation.
And Letitia Dukes is a social worker, is that right?
Yes.
She can't change medicine. Can't
December
order.
9th, there was another telephone encounter, it's called, right?
Yes.
And yet again, her husband, Pat, was involved with this call, right?
Yes.
So does this put Patrick up to around 4 times, maybe 5 times, that he had been involved either in person with your business or on the telephone or on the telemetry or whatever it is, computer?
I spoke with him on the phone twice. He was in one of our visits on December 6th, and it appears he was in the visit with Letitia as well.
So this would be a Rebecca Gelada telephone
Yes.
encounter on December 9th, right?
Correct.
And on that occasion, Lindsay, and it says, and her husband, called this writer, that'd be you, right?
Correct.
Regarding the plan to taper, correct?
Correct.
And they both agreed that Lindsay's symptoms remain too acute. What does that mean? What's acute mean?
Severe.
Did they say that she's sleeping but waking up? Let me back up. Was he telling you all of this while she sat there? She wasn't saying much in that conversation, was she?
I don't recall who was saying more than the other person.
Do you recall that she indicated that she wanted her husband to be involved?
How? Now, maybe it's just the way my brain works, but if things are outside the usual, like i.e. a husband calling me, oh, and let's see, Mo found you on, thank you. Well, I'm glad. And it does come from not only a holistic, I am a citizen of this planet and these beautiful children are no longer on it, but there is a unique kind of anger that I'm feeling as these doctors just continue to take account or not take accountability. And a nurse practitioner can, under certain licensure in states, and I guess psychiatry is one of them. So she's not only a nurse practitioner, but she has additional psychiatric background or training. Now, a social worker cannot do anything about the medication. They can only help with sort of cognitive behavioral therapy and kind of supportive therapeutic modalities. But to tell her to wait if she is experiencing, acute symptoms because she's on vacation is ridiculous.
To speak for her because she was really decompensating, right? She wasn't self-reporting and self-advocating too well for herself at that point, was she?
I just know she did have her husband on the call, and he did speak on the call.
They indicated that she was waking up with panic symptoms, right?
Correct.
What panic symptoms? What does that mean?
Panic symptoms can be this sudden rush of intense
That's not what can be. What did she tell you, or what did her husband tell you? Her
panic symptoms. Panic symptoms.
What were they?
Panic symptoms are racing heart, intense fear.
No, how did they describe Lindsay expressing her panic? This is something you should be writing in her notes because, again, you need to learn the patient's language. What is their language of distress? Every patient's language of distress is going to be different. Lindsay's was obviously, reaching out, researching, asking questions, trying to advocate for herself until it all became too much, and then she brought her husband. So her distress, language is going to be different than someone who's saying more outwardly expressive, more rageful, more irritated. And if you aren't writing down your patient's specific language of distress, the way they communicate distress, then how are you effectively taking care of them as a psychiatric nurse practitioner? Your job is to have all of the knowledge and then to understand. You don't have to completely become the patient, but you do have to recognize their language of distress, their language of understanding to be able to effectively give them the information that you have. Why am I putting more thought into patient care than this woman?
Those are panic symptoms. Sudden rushes of intense anxiety that seem to come out of nowhere.
Okay. Is that something that you learn in school, or is that in a book? Is it in the DSM, or what? So we all have our own opinion as to what panic symptoms might be, but from a medical standpoint.
Those are what panic symptoms are.
Would you agree that Patrick, in this conversation, also indicated that she was having intrusive thoughts yet again? Right?
Correct.
What were the intrusive thoughts that she was having when she wakes up with panic symptoms?
I don't recall the specific intrusive thoughts. I recall asking about safety and that she did identify having thoughts of suicide.
Well, Patrick told you that she has thoughts of suicide, right?
Lindsay as well.
Okay, so I'm asking you what you, as an invested healthcare provider, told this woman.
Oh, ma'am,
To advise her.
ma'am, the absolute ridiculation of semi-smiling when he says invested. He is using it to take the piss. He is not saying you're invested. Oh my God, and I'm the one that's potentially autistic? I need to see that again.
Lindsay as well.
Okay, so I'm asking you what you, as an invested healthcare provider, told this woman to advise her what your investigation revealed. If you have a patient tell you, I'm having intrusive thoughts, what were they?
I recall that they were intrusive suicidal thoughts.
And is this a frequent theme that you noted?
I don't know if it was a frequent theme that I noted, but I know that it was documented several times.
You wrote the words intrusive thoughts. Were they about hamburgers? Were they about Lady Gaga? Were they, God forbid, about the Kardashians? What were the flippin' flapjack intrusive thoughts? Like me wanting you to move just a little bit so that your microphone will be in exactly the right place for me to get another screenshot. Okay, Dr. Doofenshmirtz, seriously. Hell, even no, I take that back. Because Dr. Doofenshmirtz from Phineas and Ferb was at least a good dad and not really a great evil genius anyway. So I take that back. Dr. Doofenshmirtz, good dad. Not so great evil genius. Kind of okay guy.
Throughout her course of treatment with providers in my program.
So at this point, with all the providers of your program and her indications, as well as her husband's, about the
Just a little bit up. I just need you're like a millimeter off and it's driving me nuts. Just good posture. I just need like half a
number of times that she had suicidal ideation. Did you prescribe more drugs for her?
At this occasion, I prescribed Valium.
You bumped her up to Seroquel to 400 milligrams, didn't you?
Yes.
Did that help? How'd that work out?
At 200 milligrams, she was able to sleep. So I felt that the manic symptoms in her mixed presentation were alleviated at 200.
So on December 12th, she sent you one of those messages. Thank you, Rebecca. December 12th. She says, for the last 3 nights, I've taken 2.5 milligrams of Valium and 200 of Seroquel. I have to say, I do like the way it makes me sleep deeply and soundly for about 7 or 8 hours. I don't like the way I feel in the morning. That you read that to the jury for the DA, right?
Yes.
But then the rest of the sentence is incredibly depressed and unmotivated to do anything at all. Do you remember her saying that?
Commonwealth, you absolute assholes. Commonwealth, this is the kind of shit that as a jury, I am no longer paying attention on direct with your witnesses. These repeated lies, these repeated omissions, these facts that, well, Lindsay she said she slept fine. Come to find out it's a, longer sentence in which she says, yes, but then when I wake up, I feel dead awful. So I'm getting sleep, but now I feel awful during the times that I'm awake. I do not understand what the Commonwealth is trying to achieve here, because all they seem to be doing is bolstering the defense's case that she went to the doctor, she asked for help, and all she was given was more meds. It's just I'm so upset.
Yes.
Now, you'd agree with me that that's one of the observations that you make, or symptomology of a person that's suffering significantly from postpartum anxiety, depression. She's incredibly depressed and unmotivated to do anything, right? What does that mean? What does she mean by that?
I'm not sure I understand the question.
When she says that she's unmotivated and is incredibly depressed, was she able to go shopping? Could she get in the car and drive? Did you know that she stopped driving?
I was not aware of that.
On December 12th, she saw Letitia Dukes. Patients reporting thoughts of SI, suicidal ideation, but no plan. She contacted Crisis over the weekend and will be starting a PHP in Norwell. What does that mean?
Partial hospitalization program?
Okay, and that's because, yet again, she's reporting the suicidal ideation, correct?
Correct.
And there's a difference between suicidal ideation and having thoughts of suicide, right? Under the DSM, is there?
There's suicidal ideation can be a spectrum.
Okay. On December 13th, telemedicine in the perinatal behavioral unit. Again, there was a concern about suicidal ideation, and her look underneath Edinburgh postnatal depression scale, if you have it, was now 20. It's still severe, right?
Correct.
So what did you do on that date, if you know, December 13th?
I recommended that she continue Seroquel 200 milligrams and Valium 2 milligrams.
December 19th, telemedicine with Letitia Dukes. And this is when she indicated that she was going to contact women and infants, and Letitia helped her out to do that. So she went to women and infants on the 20th, right?
Correct.
Okay. So as time went on, and she had gone to women and infants and was unable to be treated on December 20th and went home, or picked up by her husband, what was her course of treatment after that? You didn't talk to anybody at women and infants, right?
At that time, I did not talk to anybody at Women and Infants, but I do know that we re-referred her in a few days.
I know you already told us you re-referred. My question is real simple, and I don't mean to be bully. I just want to ask you,
Yes.
did you talk to anyone at women and infants?
No.
So, as I read the record, which is an exhibit, women and infants, December 20th, differential diagnosis, concern about medications, reaches out to Rebecca Gelada, no return call from Gelada. You don't recall that. You don't know what happened to her after that, do you? Other than going to McLean.
I know that she went to McLean.
Right. Do you know when she went into McLean?
At the end of December, early January.
Okay. Did you review the McLean records? Because you have access to them, right?
I do not have access to them.
You don't?
I don't.
So if you're treating a person for all of the stuff that we've talked about, and it's now apparent that things have decompensated so bad that they have voluntarily admitted her to a locked ward in a mental institution, is it important to Rebecca Gelada to find out what the diagnosis and treatment was of their patient?
Yes.
Did you find out?
I did not.
And anytime you called in an ROI, anytime you needed a release of information, such as a HIPAA release, she would have signed it, right?
Objection.
Overruled.
Oh,
You have no reason.
sit down, Heffalump.
Speculation.
Well, not hardly.
I'm going to allow that. The jury can weigh that. You can explore that on cross-examination.
Begone, Heffalump. She's like, but this is making my client look really bad. And my case look just as bad as my hair and bow.
Redirect, I'm sorry.
From your treatment of Lindsay and her efforts to be a good patient and tell you all what her symptoms were and third-party contacts and everything, to your opinion, she would have signed a release for you to get access to pretty much anything you wanted, right?
I'm not sure if she signed a release for McLean to be able to speak with us.
Did anybody ask her? Did you ever ask her to sign a release?
I did not.
That's all I had, Your Honor.
All right. Well, let's
All right,
see.
Attorney Buckingham?
Okay, now we will be on current day. No, that's me. I don't need me. I need the next day. I need current day. No, that's yesterday. Allow me to be able to work, my
Yeah.
computer like
You ever
a
heard of that?
professional.
Polypharmacy?
I've heard of
All right. Oh, didn't mean to do that one. I am a professional. This is going swimmingly as per usual. Okay, let me make sure I boost the court because it is we are dealing with Attorney Reddington and he has a mycophobia.
District Attorney Shannon Buckingham.
All right. Well, good morning, everyone, and good morning, counsel.
Morning.
Good morning, Ms. Clancy. All right. So before we get going, let me talk to counsel about today's schedule and kind of where we go. So if I could see everybody at sidebar, please.
It's a sidebar.
So we'll step to the jury at this point.
You still have the driver in the DVD?
Yeah.
It might be in it.
I don't think I made that mistake.
Hey, all persons having anything to do before the Honorable William Sullivan, Justice of the Superior Court, now sitting in Plymouth, within and for the Commonwealth. Draw near, give your attendance, and you shall be heard. God save the Commonwealth of Massachusetts. This court is now in session. Please be seated.
Good morning, Your Honor. May I proceed?
Yes, please.
Your Honor, before the court today, we have the continuation of the jury trial in the matter of Commonwealth versus Lindsay Clancy. Ms. Clancy is present. She is represented by Attorney Kevin Reddington. The Commonwealth is represented by Assistant District Attorney Jennifer Sprague and Assistant District Attorney Shannon Buckingham.
All right. Well, thank you, Madam Clerk. Good morning, everyone. What I'm going to do is, I'm going to ask you those questions to make sure everybody was able to follow my instructions.
One second, start right there. Raise your right hand.
Good morning. Do you solemnly swear that the testimony and the evidence you submit to the court and the jury?
She has a nice falsetto. I think she was part of the Bee Gee Brothers.
Thank you, sir. You may have a seat.
Watch your stuff.
All right. Good morning, sir.
Going on.
All right, counsel.
Thank you. Good morning.
Good morning, ma'am.
Could you please tell the jurors your first and last name?
Yes. First name's Dan, last name's Lawler,
And where are you employed?
with the Massachusetts State Police.
What's your rank with the state police?
Sergeant,
And how long have you worked for the state police?
9 years.
At some point, did you work in an assignment with the Plymouth County District Attorney's Office as part of the State Police Detectives Unit?
Yes.
And how long were you with the Plymouth County DA's Office State Police Detectives Unit?
From March 2021 until June 2025.
I'm going to draw your attention back to January of 2023. Do you recall going out or responding to an incident that occurred in Duxbury?
Yes.
And
No, we must protect the Brits. We must protect the Brits because from them comes Bakewell tarts, sausage rolls, which if you have never tried a Greg's sausage roll, look, I am willing to reconsider colonization. I am in a minority, though. I can be bribed with Greg's sausage rolls, is all I am saying. If I were given a Ted Lasso-like experience where I had to go over and coach a soccer team for a year, now, there would not be many wins, but I would enjoy the hell out of it. Basically, I would, yeah, pretty much. I would be a bajillion and 12 pounds, though, because, oh my goodness, Bakewell tarts. My local Kroger now stocks them, and I have to, I'm allowed to get one box a quarter because those things are freaking awesome. But I would eat them every day. I do have a oh, that and Maltesers. You guys put the right amount of malt in your, well, essentially your equivalent of Whoppers. American malt balls are weak sauce. I don't know if it's a UK thing or all of the Commonwealth countries, but you guys, Maltesers, spot on. The correct amount of malt.
that was, the incident occurred at 47 Summer Street in Duxbury?
Yes.
And you're aware that that involved a death investigation where 2 children had been declared deceased, and at the time, there was another child that was being treated at the hospital?
Yes.
What are we? No.
Responding to.
This is going to be another bit of them bringing in clothes. And as I have said with every single first responder who has been involved in this case, I can't imagine the guilt and the sorrow and so many things that every single officer and, person involved in this case probably has had to see. That being said, this all could have been stipulated to, and I would much rather get to. I don't need to see her clothes. I don't know what the Commonwealth's, rationale for any of this is.
Mr. Reddington.
So your position was as a sergeant for the state police on these dates that you testified to?
No, sir. At the time, I was a trooper.
Trooper.
Yes, sir.
You assigned to the district attorney's office?
Yes, sir.
It would be the Plymouth County DA's office, meaning these prosecutors here, right?
Correct, sir.
Actually, you have an office in their office.
Oh, he wanted to say these swamp hags. You could see him editing in real time. You're like, cannot call them heffalumps. Prosecutors.
Office, right?
Correct, sir.
You don't have to call me sir. So on the first.
Reddington, just when I think that my heart can't grow one more size, it is like the prosecution's bow. Like, this is the size of my heart right now, Reddington. If there was a correlation between admiration and bun size, this is how much I love you, Reddington. You don't have to call me sir. Mr. Mo was like, "You are so incredibly proud of yourself for that." I was like, "Best $11 I have ever spent in my entire life." And he's like, "You are the weirdest person."
First time you got involved with this case was on the evening of, was it the 24th or 23rd?
Tuesday.
Oh God, the lip smack.
I think it was the 24th.
Okay. And do you recall what time it was that you went there?
To the South Shore Hospital.
Yes, I'm sorry.
Approximately 7:30 p.m.
Now, at that point, you had known, obviously, that this was a major investigation involving the death of 2 children and 1 serious injury to another child. Is that correct?
Correct.
The media was absolutely insane all over the location of the house and in the hospitals and everywhere. Isn't that right?
I recall media at the house. I'm not sure about the hospital stuff.
Okay. It was a fairly horrific and largely attended to, if you will, event. Is that correct?
Yes.
And Lindsay was, when you went to the South Shore Hospital, that's where you saw her before she was transferred to the Brigham and Women's, right?
Yes.
When you went in to see her at the South Shore Hospital, she was in the emergency room, right?
Yes.
Would you agree with me that she was pretty well, she had the intubation tube in her mouth, she had tape on her face, she had her arms all taped up and wires and tubes and everything else, right?
Yes.
And it was a very confusing and, quite frankly, shocking sight to walk into that room and see her there in that condition, right?
Yes.
And you, about your duty, collected clothing and her wedding band, correct?
Yes.
And you went through all that with the items you seized, and you introduced those into evidence and noted what the government said appears to be stains, but it was blood on her clothing. Is that right?
I would say.
Bitterly.
Bad dancer, do not give me any ideas. I will make an entire costume out of that, because it is legitimately from the Grinch section, and I have said, "Oh my, if only the prosecution's souls would grow by 2 sizes, they would have one." I don't know. It tickled my very weird sense of humor. And of course I tried it on in the store. Look, I was already intending to buy it, so I did have to try it on to see if I thought I could achieve the constructionology needed to wear it for clothes.
Yeah.
In your experience.
Yes.
Any shoes? Did she have any shoes, sneakers, slippers, anything like that?
I don't recall shoes. I think 2 black socks, but I don't recall shoes.
Right. If there were shoes on her person or brought to the hospital, the odds are that when they saved the clothing, they would have saved the shoes as well, right?
Yes.
So you took the clothing, and then you went to the Boston Children's Hospital, right?
Yes.
And after you left the Boston Children's Hospital, you went back to the house and then assisted in the search of the property with a search warrant?
Yes.
And were you the lead investigator at that point, or were you one of the guys just searching?
I was not the lead investigator.
But there was a court order, search warrant, right?
Yes.
And you, meaning collectively you, knew that you had a search warrant that authorized a search for a number of items, including medications or pills or pill bottles, right?
Yes.
I don't have to grab this and ask if you saw this. You never did see that, did you?
I did not recall seeing that, sir.
You don't know what, if anything, was inside that item, right?
I don't know.
And counsel asked you whether or not it's a collaborative effort on the part of the detective units, and that you all collaborate and work together. Can you explain that? Do you report to each other? Do you keep each other advised as to what you get for evidence?
Yep. So when we go into a house, we're not familiar with the layout. We'll walk the house and figure out where bedrooms are located, and then.
No, moron, you do understand that he's pointing out the fact that of all that multiple ones of you, none of you are competent. He's really not asking you for any other reason than to make you look like a jackass, because you're going to explain it as you being highly competent, and then you're going to have to square the circle of how none of you highly competent, A-team investigators managed to look in the nightstand. Even if you were just a curious schmuck, like if I were a police sergeant, I mean, part of me would just be generalized curiosity, which is why I shouldn't be a police sergeant. But still, you're telling me none of you opened a drawer, because the way you're tactically explaining yourself and what you actually did is making you look even more stupid. I know you don't realize that, but I think the Commonwealth is cogent enough to realize it.
Essentially, you kind of just break up into teams, if you will, and search the residence as evidence is located. And at that time, as the evidence officer, I would be alerted that, hey, there's evidence here. We're going to document and collect it.
Okay. And you videotape the scene and you take photographs of the areas, the different rooms, right?
I do not, but crime scene does.
But you were in the house and you were able to observe the rooms. You could see all sorts of wall hangings and paintings and fingerprints and handprints and all that stuff on the wall, right?
Yes.
Downstairs, you saw in the basement, or the finished basement, that there was an area that was an office, or appeared to be an office. Is that correct?
I don't recall the exact layout of the basement.
Do you remember that items were seized from the basement, like a Mac Pro laptop, something like I have right here? Two of them that were seized. You remember that?
Yes.
And from your investigation, you're aware that those would have been Pat Clancy's laptops, his business and personal laptop, correct?
At the time, I'm not sure who the laptops belong to, but I know they were collected.
Okay. And how about Lindsay Clancy's, her cell phone? Was that seized, if you know?
I believe that was seized from the master bedroom.
From the master bedroom. And do you remember, was it located on the bed?
There was a phone located on the bed. I think there was another phone located in a dresser drawer. I'm not sure which phone was what, though.
All right. So both of those phones, regardless which one was what, did either one of them have blood on them?
I don't recall.
But if you guys were seizing the items in the property, such as the cell phone that had blood on it, in your experience, you probably would have remembered that, right?
Correct.
And you don't remember that?
I don't.
Okay. You did notice a lot of blood on the floor and on the walls, on the mirror and the window ledge and that area. Is that fair?
I recall blood on the floor by the mirror, and then blood on the floor going towards that back right window.
Okay. At no time did you ever come across or discover a, what do you call it, Apple Watch, right?
No, sir.
And after you all concluded your search of the home, and how long did that take? A couple of hours?
Probably. I don't recall the exact time we concluded.
Okay. The next thing you did was to go to the Brigham and Women's Hospital. Is that right?
After the search warrant?
Yeah, she had asked you a question about Brigham and Women's. I mean, did you do something else in between? I don't know.
I don't recall exactly what I did after the search warrant, but at some point I did go to the Brigham.
Okay. Can you tell us when you went to the Brigham?
I don't recall the exact date. I was
All right, so whatever date you went to the Brigham, you went there for what purpose?
She was transferred to that facility, and it was to maintain custody of her at that point.
So you were going to maintain custody of her?
So the sheriffs, I believed,
Right.
had custody of her, and then our unit was tasked to facilitate providing coverage over the next couple of days.
Right, and she was actually in the bed with all, again, tubes and all sorts of things coming out of her body when you saw her, right?
Yeah, she was in the hospital bed.
And she was in like an emergency room. It was a little small room with a lot of machines in it that took up a lot of space, right?
I don't think she was in the emergency room. She was in one of the floors.
One of the floor rooms, but it was an intensive care unit, right?
I believe it could have been the surgical intensive care unit.
Surgical intensive care. And when you went there to facilitate custody, who were you facilitating custody for? The DA's office?
Yes, essentially.
Okay. And whatever, do you remember how many days? Was it like 2 days, a week, 2 weeks after the incident that brought you to the house in Duxbury? Do you recall how long it was before you went to the hospital to maintain custody, facilitate?
I don't recall how many days, maybe 2 or 3. I'm not sure the exact count.
All right, so she had been transferred out of South Shore Hospital. She was transferred to Brigham and Women's Hospital. You went to Brigham and Women's Hospital. I imagine you had to go through security to get in there, right? Well, your badge, right?
At some point, yeah, we were probably assisted with security to get
Right.
out there.
Well, you know that nobody could get access to Lindsay Clancy in that hospital, and I mean nobody, right?
Correct.
And this went on for day after day after day, to your knowledge, facilitating, right?
Correct.
Her parents couldn't get in to see her, correct?
I don't believe so.
She had an attorney that had difficulty, not me, but another guy that had difficulty getting in to see her. Isn't that right?
I'm not aware of that difficulty.
I had to get a court order to get a doctor in there to see her, didn't I?
Yes, it was a court order.
And when I got the court order, a doctor came in and met with Lindsay pursuant to that judge's order. And that was Paul Zeisel, correct?
I believe that's the name. I'm not sure if he was a doctor, but I believe that was the gentleman that came on the court order.
Okay, because
Okay, so you're just like letting random people who may or may not be doctors into the ICU to examine a patient? Again, your statements have to make an internal logic to the conversation that we are all participating in.
only because in your direct you said that he was not a doctor, but he was a psychiatrist. So, I mean, it's just, you knew that he had something to do with head doctor.
I do want to take this. Jakety is pointing out, now it is currently not storming in my neck of the woods in Indiana, but areas of Indiana in the Midwest are just getting a lot of rain, a lot of storms, a lot of water in a very short amount of time. The ground is already super saturated, and be mindful of your surroundings. Do not try to drive through flood water and things like that. Not that I think anyone in chat would, but if you have new drivers, if you have kiddos, or maybe, even college-age kiddos, a gentle reminder that don't try it, turn around. There is nothing braver than, a young adult who maybe isn't aware fully of how dangerous that can be. So I do make a point to tell my girls, who are the only ones driving, about it when we're getting a lot of weather. But do be mindful of your, current situation, and keep Ryan Hall or Max Velocity or whomever you keep up if you're in for possibility of some storms.
Psychiatrist, psychologist, something like that.
Correct.
Okay. Did he have to clear it with you to get into the room?
He checked in with myself and the other trooper. We were advised that he was coming and to let him in on the court order.
All right. Now, I wasn't there on that occasion, right?
No.
And when Dr. Zeisel, or whoever it was, went into the room to see her, it's your memory that he was allowed to shut the door. Is that correct?
I believe he shut the door.
Now, you were involved in this investigation pretty intensely, working with the DA's office, right?
Correct.
Isn't it fair to say that one of the contentions of the district attorneys is that Paul Zeisel, my doctor, that I got a court order to get in to see her, told her to call Pat and tell him that she heard voices?
Can I see counsel sidebar in regards to this?
Interesting. I was not aware that that was kind of the nexus for the state being so scornful about the auditory hallucinations or their, I guess. Okay, I'm gonna look, Commonwealth. I don't know how you do this. Good Lord, ridiculous woman. Besides, you didn't think I was unprepared. Let's put it on a jaunty little angle and pull out some air in front. And okay, yes, ma'am. I am prepared to mock in all seasons, in all shapes and sizes. It's really, again, do not mess with me. I am a Jedi, but I am a Mace Windu. I am not the Obi-Wan that you are looking for. I am the Mace Windu of, the senator's the bad guy. Mace Windu never trusted Senator Palpatine. And I was like, I'm with you, Mace. Let's get the old guy. Everyone else just didn't see it. Me and Mace calling out evil. But you can't put that back in the tube. Attorney Reddington is incredibly aware of everything that is going in that courtroom. Well, yeah, I didn't say it went well. We would have had to do a better strategery. Again, Mace did that thing where he was like, "Oh, holy crap, it's you," when he should have said, inside voice, "Oh, holy crap, it's you. I need to go get the council and the Jedi, and we can do the Vulcan mind meld, and they can all see that this MFer is the total evil guy we've all been searching for." But instead, he was a little overconfident. It happens when you see things that other people don't. And it bit him in the ass. I want the full Mace Windu trilogy, but not under current management.
All right, so counsel, what we're gonna do is we'll have it, just so the record's clear, the jury's out of the room at this point. We will just conduct a short voir dire on the issue that we talked about over at sidebar. So I'll allow Mr. Reddington to ask questions at this point, and then I'll allow Commonwealth to also ask questions. Go ahead, counsel.
Okay, thank you. So you're in the hospital at Brigham and Women's, correct?
Yes.
And when you're there, with the purpose of, obviously, with other law officers to enforce the fact that she's in custody, Dr. Zeisel, or a doctor, came in pursuant to a court order, right?
Yes.
All right. And obviously had been cleared through security and went into the room where Lindsay was laying on the bed, right?
Yes.
You don't know, or you don't recall if he closed the door or if he kept the door open or if it was half open. You just don't remember, right?
Yes.
Okay. Would you agree with me that in the course of preparing this case for trial, that you have worked and collaborated with the prosecutors, the two district attorneys, correct?
Yes.
And you guys would talk about theories of the case and evidence that they want you to run down, perhaps as an investigator, or try to obtain, or interviews and things of that nature, right?
Yes.
And one of the theories that they had indicated to you is that Patrick Clancy had indicated to the investigators and to the grand jury, I believe, that Lindsay called him from the hospital, right?
I recall that.
And that Lindsay used that doctor's cell phone to call him from the hospital, right?
Yes.
And they basically had a theory that they wanted to run with, that Zizelle told her, Lindsay, to say that she heard voices, right?
I don't know if it's a theory or not. I just recall that conversation at some point.
Okay, so when was the conversation?
I don't recall exactly when.
You remember where the conversation was?
No.
You don't, okay.
I'm assuming at the office. I just don't recall specifically when.
And who?
Is the conversation a unicorn? Are you currently hearing auditory command hallucinations about whatever it is that the Commonwealth told you to say? Again, Massachusetts, I ask you kindly, look, I feel like I'm in the middle of some sort of burnout. I'm a little fatigued. Could you possibly, I'm not asking for full normal. Normal is on a spectrum. I don't think anyone actually qualifies. If I'm honest, given my 42 years of experience with people. That being said, there is a spectrum of normal. And dear God, Massachusetts, I'm gonna need you to try just one standard deviation above what you currently are doing for my sanity. Thank you so much. Not baby steps, baby steps. Half a standard deviation would be appreciated at this point. I believe a standard deviation is 25 points, so that's just 12.5 points, please, for the love of God.
Who was it you were talking to?
Probably could have been one of the troopers in the office working the case.
One of the troopers, is it McGilligan?
Probably he's the case officer, so I imagine it probably wouldn't.
So, I just want to make sure with chat. So follow me on this so I can make sure that I am understanding this level of stupid correctly. They decided, both heffalumps in the Commonwealth, the attorneys, all decided to base the fact that Lindsay has faked her entire mental health history on conjecture that when she was alone with a defense psychiatrist, the psychiatrist, knowing that any sort of ethical and professional lapse like this would absolutely lead to not only professional, ethical, but probably licensure issues, if not civil and possible criminal liability, decided to get on a phone with the police right outside the door to cook up a defense? What in the name of sniffing glue in Lollapalooza is going on here? Let's continue. I am riveted. This is literally a car crash I cannot look away from.
Him, sir.
Probably could have been him.
Yep.
How about any of the prosecutors? You talked to the DAs about that?
I don't recall specifically speaking to a prosecutor about this.
Well, how about not necessarily specifically, but do you have any memory of talking to the prosecutor about, quote, this, end quote?
No.
So what is it that your memory is that the trooper, whoever it may have been, or the investigator for the state police may have been, what did that person tell you?
That at some point when Lindsay was in the hospital with the doctor and the court order, that she made a phone call to Patrick and they discussed circumstances of the case, and then he was interviewed later on and communicated this phone call to, I believe, Trooper McElligan.
And what did McElligan tell you about the conversation? What the theory or the understanding was that
during the conversation, Lindsay communicated to Patrick that she had heard voices in her head.
and there was also the conversation regarding the psychologist is basically the one that planted that idea in her head, right?
The conversation between Trooper McElligan and I?
Yeah.
I don't recall that specifically. I just recall the facts that communicated to me that there was a phone call between Lindsay and Patrick.
Okay, you already said that. I know, and I apologize. I don't mean to cut you off, but let's cut to the chase.
Yeah.
What I'm asking you are voices. You know what that means when someone hears voices, right?
Yes.
You may not hear voices. I may not hear voices, but some people might hear voices, right?
Yeah.
That was
Oh, your internal voices should be screaming, sir. That little voice that says in the Ralph Wiggum voice, like, I'm in danger. You should be feeling that all over. Your internal voices should be screaming to run. I legitimately cannot believe it that this is the timeline. So we are basically learning 12 days into trial that the Commonwealth, their theory on this is that Lindsay and the psychiatrist got together along with Patrick and Reddington to cook up psychosis because that's easy to prove and, wasn't getting, mockery and pushback from the Commonwealth. He just decided to go for difficulty. He really, when he commits to acting, he commits to acting. So they cooked together this plan, but they were so dumb that this plan was intercepted and figured out by you. And yes, I'm implying you're stupid, just in case that was not clear. And then you and the Commonwealth all decided that this is what happened, and that's why we are watching this trial. Holy goodness. Welcome, Mr. Cooperators. I am legitimately flabbergasted, and we are legitimately way behind, but apparently we have come to the portion of this level of crazy, insane, Massachusetts today, where we come to find out that the assumption that Lindsay was faking her mental illness was cooked up. This entire like conspiracy that Lindsay was faking all of this seems to have originated from the fact that the defense brought in their own psychiatrist to evaluate Lindsay. And while the police were outside of the room, he did have a court order that allowed him to shut the door. He allowed Lindsay to talk to Patrick. So those facts are not in dispute. Now, what the Commonwealth believes is that during this confab time, again, somewhat initiated by Reddington, it implicates, by implication only, that the psychiatrist, in paradox to everything, legally, ethically, and morally he's supposed to do as a psychiatrist in a clinical legal case, decided to cook up a totally fabricated defense of auditory hallucinations, all mind you, all while at any point the officers could open the door at any point just to make sure Lindsay's still in the room. They did all of this diabolical scheming, and the Commonwealth, the Tweedledum and Tweedledummer with the bows over here, decided all of this amounted to a functional case. CERN, I swear to God, if you guys don't stop messing with the timeline, I am going to have a mental breakdown, okay? I swear to God, every week it is a stupider dimension that we have somehow slid into, and I cannot with this. Massachusetts, I also blame you. But basically, at this point, the jury is out of the room because Attorney Reddington basically on cross brought out that there had been allegations made against his expert psychiatrist that he had basically helped fabricate this entire defense, whole cloth, with Lindsay in that one visit. And this was an idea that apparently Cletus over here and his friend Kevin or something decided to speculate about in the office, as you do. They're like, oh my God, what if he done fed her the whole idea? And apparently, instead of laughing hysterically at these two chuckleheads, the Commonwealth was like, oh my God. That is the smartest thing I've ever heard. So this is currently where we are in the trial right now. I am trying to summarize the amount of stupid that I'm currently processing through my body, and I think I might need an EpiPen. Is there an EpiPen for stupid? Is there an overwhelming stupidity protocol that I'm supposed to follow?
Discussed with McElligott, wasn't it?
Yes,
And what is it that he discussed with you about Lindsay hearing voices?
that's what she had told Patrick on the phone call, that she heard voices.
And when she told Patrick that she heard that on the phone call, the prosecution determined that it was Zell, or whoever that doctor was, you don't recall, that told her to say that for some type of a defense, right?
I don't know what the prosecution determined. All I can say, that's what I recall, the conversation between Lindsay and Patrick.
Okay. About when
The
you say
voices.
the voices.
Yeah,
And the conversation also included the fact that it was the psychologist that planted that idea in her mind. That's the theory, isn't it?
that would be the theory, but I don't recall having.
That's it. Wait. Your answer is that would be the theory, right?
Jesus. No, Cletus, again, Commonwealth. I'm going to need you, Commonwealth. If you insist on being evil, I'm going to need you to do it well, okay? There's a reason that Scar is a lovable, theatrical, yet, and memorable villain, whereas you are just stupid. Okay, so if you're going to engage in evil, I'm going to need you to remember the number one rules of Disney evil, since you're wearing the bows. Never, ever entrust your henchmen with anything that would require more than 2 brain cells to be functionally competent at it. I can't believe the Commonwealth relied on troopers for competence. Hoisted by your own petard.
Correct.
Okay.
Agreeing with you that that's
Okay.
what was discussed.
All right. And this would be you and is it McElligott?
McElligott.
McElligott.
Yes, sir.
And you're unable to assist us, though, with any of the detail. You do recall that there was a conversation about that.
Correct.
And in the
Yikes.
conversation,
Be
it was
careful,
about the
guys.
conversation that Lindsay had with her husband, indicating about voices, right?
Correct.
Using the psychologist's cell phone, right?
Correct.
And there was an indication that the psychologist told her to basically say that. You just told us, yes.
Yes.
Okay.
Yeah.
That's all I have.
Attorney Buckingham.
Sergeant Lawler, at the time that you were at the Brigham Hospital and at the time the doctor came in, you didn't know anything about a theory of the case, correct?
No.
No, he distinctly said in the voir dire, if you would have just listened, you heifer, that this conspiriosity, Fig Newton of his imagination, happened and germinated. Its nascent womb, if you will, was the office next to your office. So it didn't happen in the hospital. So therefore, his knowledge of any of this happening is irrelevant at the time that he went to the hospital. So why are you asking this dumb as hell question? Also, your suit really, really sucks.
And you didn't know or overhear anything in outside that room about conversations between the doctor and the defendant, did you?
Correct.
And you indicated that you never had a conversation with the prosecution about their theory of the case, did you?
Did not.
So anything that you recall was simply conversation with another trooper in the unit.
Correct.
And as you sit here in your testimony today and testify about your memory of that particular.
So, as you testify right now, are you telling me that troopers engaged in a level of girlhood gossip that would make a 14-year-old at Hot Topic blush? He needs a mustache to twirl to look the part. No, that would indicate he was a smart villain. He does not deserve the handlebar mustache. He's much more of a pinky. If we're going to put him on the spectrum of evil genius, he's a pinky. Unfortunately, so is she. So it really is the blind leading the blind here at this point. It is like a Donner's party of intelligence. No one's going to make it home.
Night.
Mm-hmm.
Is anything about that conversation with Sergeant McGilligan guiding your testimony?
No.
You changed, or has your memory changed as to that incident after you had this conversation with Trooper McGilligan,
No.
Sergeant McGilligan? And in fact, you don't know anything about whether there's any evidence about Dr. Zeisel giving or prompting the defendant to have that conversation with her husband, do you?
No.
All you know factually is what came out of the investigation from what Patrick said the call was and who he said the call was from and how the call occurred, correct?
Correct.
Thank you.
So, I mean,
Yeah, please.
so basically, my contention is that you're obviously up here testifying as honestly as you can. It's pretty apparent, right?
Yes.
And you're very consistent with your oath, and you understand that it's important. And you're trying to, it may be difficult, but you're trying to explain what your memory is about conversation with the lead investigator, McGilligan, right? I mean, you're trying to tell us what your memory is, right?
Yes.
It's not a trick question, Cletus. He's asking if you're being truthful. I know it was more than 4 words, but try to stick with us here.
So your testimony pertains to your conversation with the lead investigator, McGilligan. It's got nothing to do with the fact that you don't recall this or you don't recall that. What you've testified to is for the judge to consider, right?
Yes.
Okay, that's all I have.
All right. All right. Why don't we do this? I'm going to take about a 10-minute break at this point.
Okay.
And we'll come back out and we will resume cross-examination. Okay?
Court, all right.
Now, again, I'm not shocked at the length of the break being longer than actually 10 minutes because these are incredibly serious allegations to be made about an expert witness. Essentially, what the Commonwealth is alleging is that one of the expert witnesses for the defense invented whole cloth Lindsay's defense. Basically, he helped her, he coached her, he was working behind the scenes to help Reddington, take her severe postpartum depression and have it become postpartum psychosis. Now, that is a really, really big allegation. Bob Mata is covering this live from the courtroom, and he was quite shocked about the allegations that were being made and all of that. It was quite shocking, and it's quite shocking to see, as we've caught up to it, because these are things that, where Attorney Reddington has implied some level of a neglect or professional malfeasance or malpractice. This is basically going out and saying he is going in there and he's peeing on his credentials. He is behaving unethically. He is basically essentially helping lie to the court. These are incredibly, incredibly serious allegations against an expert witness from the Commonwealth.
Court, all right. Privilege entry.
Now, basically, they're coming back from, they did a voir dire outside the presence of the jury. Basically, we learned that we didn't get a bead into who exactly from the Commonwealth or from the trooper came up with the idea of incorporating this officially into the case. But we did learn that this was a subject of conjecture in the trooper's office. Now, I do need you to keep in mind that the trooper's office is attached to the district attorney's office. So it's not as though they're in the police station and the attorneys are somewhere in Nova Scotia. Uh, they are in the same office area. In fact, I think their offices are like right down the hallway. So if this was a point of conjecture, it really is sort of incestuous as to where this idea came from. But the allegation is that Cletus over here had an idea and the Commonwealth ran with it from Reddington, and then the Commonwealth is just, well, being the Commonwealth.
This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right. Members of the jury, thanks for your patience. We were able to deal with that issue. And so we're going to return now to the cross-examination. We're still going to take a morning break, as I've told you before. Might just be a little bit affected by the fact that we just took that you took that break. We didn't take that break. So with that, we're going to return to the cross-examination. Mr. Reddington.
Sergeant Lawler, we're at the point where you are assisting, if you will, in the custody of Lindsay at Brigham and Women's Hospital when you observed a doctor enter into that area and ultimately into her room. Is that correct?
Yes.
All right. And the door was either closed or open or halfway, you don't recall, which is understandable, but you just don't remember if it was closed completely or open a little bit, right?
Correct.
But either way, you
Again, so they are making allegations that a professional would throw away years of his career, his entire livelihood, with police right outside the door, or it potentially having been canted slightly open to come up with this nefarious fake psychosis plan.
weren't eavesdropping or trying to hear anything, were you?
No.
And then when the doctor finished talking with Lindsay, at some point, you as investigators were aware that the doctor had allowed her to call her husband and use his cell phone to speak to her husband, correct?
I later learned that.
And you later learned and knew from the investigation that it was fairly recently to that point that the tubes had been removed from her mouth and she was able to at least talk to a degree. And then she talked on the phone, correct?
Correct.
And after that, fair to say that you did not, when I say you, I mean collectively, all the police officers investigating for the DA's office, you did not see any reports or anything that would indicate what, if anything, was said between Dr. Zeisel and Lindsay in that room, right?
Correct.
And who is Sergeant, is it McElligan?
Sergeant McElligan, yes, sir.
And Sergeant McElligan, Joshua,
Yes,
he's the lead investigator in this case, is that correct?
correct.
And at the time, he was a sergeant and you were a trooper, right?
At the time, we were both troopers.
Oh, both troopers. Okay, so you both got promoted. And he, as the lead investigator, told you in a conversation, or perhaps more than one, that the government theory is that Dr. Zeisel told Lindsay to say to her husband that she heard voices, right?
If you could rephrase that.
Okay. Did you talk to McElligan about the theory that Dr. Zeisel is the reason that she told her husband that she heard voices?
Yes.
And do you remember where or when that conversation occurred, or how many times that you guys discussed that?
I believe it would have been at the office. I don't recall exactly when.
Okay. And there's no investigator basis for that. That's McElligot's speculation. Is that correct?
Correct.
When you went there and you observed Lindsay after the doctor left, she's still obviously in the bed because she's paralyzed, right?
Correct. You're still in the bed.
Was she restrained by either soft restraints or handcuffs or whatever? Do you remember where her hands or her wrists restrained to the bedpost?
I don't recall specifically restraints.
Okay. And you mentioned that the state police were there. That would be people that were obviously working with you, right?
Correct.
And do you remember how many state police were there that you were coordinating or assisting?
Per shift, there was 2 of us.
2?
Yes, sir.
Okay. And also there were sheriffs from the Plymouth County Sheriff's Department that were there, right?
So we relieved the sheriffs.
Okay. And how many sheriffs did you relieve?
I don't recall exactly. Probably 2 though.
Okay. And how about Duxbury Police? You recall the Duxbury Police being there?
I do not recall Duxbury Police there.
How about the security cops for the hospital? Do you recall them being there, either in the room or outside the room?
I don't recall them being outside the room.
Do you recall coordinating with the security boss, the head guy for the hospital security?
I recall having some assistance at some point from security to get up there.
Okay. And do you remember how many days it was that you were assisting in the custody situation of Lindsay before she was allowed to have family and me and different people visit with her?
I don't recall exactly how many days.
About a week maybe, or less, or longer?
Less than a week?
Less than a week?
I think, yeah. I don't remember exactly though.
And even though she was allowed to have visitors, still the police presence was there. Is that correct?
After I left, I'm not sure after I left what the visitation was like.
So when you say after you left, you mean when you left the hospital? You mean after you were finished with your tasked duty of dealing with her security and being under arrest?
Correct. After my assigned shift, I don't.
So after you were involved, obviously you don't know what happened after that.
Correct.
Okay. That's all I have. Thank you, sir.
Thanks, sir.
Redirect, Ms. Buckingham?
This will be interesting.
Sergeant Lawler, in your experience working in the detectives unit as a trooper, is it fair to say you oftentimes will have conversations as investigations are unfolding with other investigators that you're working on a case with about the case, potential evidence, theories of the case?
Yes.
And it's also fair to say that theories change over time based on your investigation, what evidence you find.
Correct.
Was there anything about a conversation that you had with Trooper McElligott about this theory that affects your testimony as you stand here today?
No.
And you didn't hear anything that occurred in that room that day that you were there when Dr. Zeisel was there, did you?
I did not hear anything.
Nothing further.
Briefly, well,
Which makes it incredibly risky that you are making this theory up whole cloth. You have implied multiple times that Lindsay has been acting, and now that you link that acting with a particular doctor, you are heavily treading on the line where he's going to have to come in to defend himself and his professional credibility.
testimony, basically unobjected to, is talking about clothes that were seized at the house and the other investigation going to the hospitals. That's it, right?
Objection beyond the scope.
Sustained. All right. All right, anything further? All right, thank you, sir.
Thank you, Your Honor.
Thank you.
Commonwealth would call Letitia Dukes as this next witness, please.
And if you're unsure what happened there, basically, in redirect or recross, you do have to keep your questions limited to what was just spoken about. And since she just tried to go back and cover something that would have been in one of those first iterations, it was not germane to what was in the previous cross, so she couldn't talk about it. Now, I believe Miss Dukes was the social worker helping Lindsay out with the behavioral component and sort of the therapy component of her healthcare.
Good morning. All right. I'm going to ask you to keep your voice up and speak into that microphone, okay? Sure. All right, thank you. Yes, Counsel.
Thank you. Could you please tell the jury your first and last name?
My name is Letitia Dukes.
And how do you spell your first name?
Latiesha.
How do you spell Dukes?
Dukes.
What do you do for work?
So I'm a licensed mental health counselor. I worked as a perinatal clinician at South Shore Hospital.
And what kind of education did you receive in order to do that?
So I have a bachelor's in psychology, a master's in mental health counseling, and a master's of education in mental health counseling.
And you mentioned the South Shore Perinatal Clinic. Do you still work there?
No, I do not currently still work there.
How long did you work there?
I worked there for about 5 years.
What did you do there?
At the perinatal clinic, I worked as a perinatal clinician, which involves like short-term therapy from prior to birth to postpartum, and supported with connection to care, whether that be therapy or higher levels of care, so intensive outpatient therapy, partial hospitalization, or inpatient care.
And do you often collaborate with patients and other clinicians at the clinic or nurses about treatment plans for patients?
Yes.
And do you help to manage the treatment plans with the patient?
Yes.
How do patients, or strike that, for your role at the clinic, doing the therapy and being the clinician, are you often referred patients by the nurse practitioners or somebody else who had seen the patient or did an intake with the patient?
Yes.
And do you work with that prescriber or practitioner over the course of the treatment with that patient?
Yes.
And as far as your role and what you do with patients, is it fair to say that a large amount of your ability to work with the patient is based on your relationship and rapport that you develop with the patient?
Yes.
And do you rely heavily on things that they report to you when you're assessing them diagnostically and trying to help them come up with a treatment plan and offering therapy?
Yes.
And one of the things that might be important in that is to assess a patient's presentation each and every time you meet with them, right?
Yes.
So do you do that in each appointment or each interaction with a patient, assess them for various things?
Yes.
And what kinds of assessments do you perform?
So I typically perform a psychosocial assessment, which is getting their behavioral health history, as well as their current presentation and reason for coming in for therapy. So whether that be a specific diagnosis or current concern, or recent like crisis or trauma, and also a risk assessment that assesses how they're doing in that moment.
Okay. And as far as the therapy component of your interactions, is that largely based on the patient?
Yes.
And what kinds of therapy can you offer in that short-term therapy?
In that short-term therapy, we offer cognitive behavioral therapy, dialectical behavioral therapy. I also offer something called EMDR, eye movement desensitization and reprocessing therapy for patients that have gone through trauma, as well as it could be even short-term support, like a couple of weeks until they're transferred to the appropriate level of care.
And in your sessions with patients, is there a minimum or a maximum time limit?
Typically, our program would go from birth to postpartum up to 2 years. If it did go a little bit over 2 years because of lack of connection to care, then it would go a little beyond that, but typically it's 2 years.
Okay, and that's the duration of your treatment or your interaction with patients. But what about in each appointment that you have? Is there a minimum or maximum time set by the clinic of when you see a patient? in a
Do you-
particular visit?
Yes. So do you mean as far as like weekly or like hour, half an hour?
Well, I guess the question is, if a patient's coming into you because they were referred and you're meeting with them on a regular basis, how long are the appointments in duration? An hour, half an hour?
So appointments could be anywhere from a half an hour to an hour based on the patient need at that time.
And when you're interacting with a patient and you're making all those assessments, are there tools available to you if you feel or you experience that a patient needs a higher level of care or is heading or is in some sort of crisis? What tools are available to you for that?
So tools that are available to me is connection to my direct supervisor, as well as crisis coordination, as well as like the crisis support numbers that are in that area. So I could either call with the patient or sit with the family, create a safety plan, and the patient can call later on if they feel like they're safe to go home and they have supports at home.
Okay. And at some points, could it be that you would need to involve authorities like the police?
Yes.
And you also are familiar with the Section 12?
Yes.
And then that it's an involuntary procedure where the court gets involved?
Yes.
Now, as far as when you do meet with patients on that regular basis, either for a follow-up or an intake, is it a telehealth situation, an in-person situation?
It depends on what the patient is comfortable with and what the patient is able to do as far as like access. So we offer both in-person and virtual appointments.
Okay. As far as when you first meet with a patient, when they've been referred to you, that first intake procedure, is there a recommendation for whether that be in-person or telehealth?
All the perinatal behavioral health appointments for mental health counseling are in person, that initial visit.
And then the subsequent appointments are oftentimes directed by the patient?
Correct.
Would there be instances where you would insist or prefer that the patient actually come in person if they've elected for telehealth?
Typically, you prefer someone to come in person because they have either like fallen out of care or there are concerns for their safety for some reason.
And if you don't have those immediate concerns and it's the preference of the patient, do you often engage via telehealth?
Yes.
I'm going to draw your attention to a particular patient by the name of Lindsay Clancy. Do you remember when your first contact was with her?
I remember it was around late November, early December.
Okay. And you're aware that she came to the perinatal clinic and was being initially treated by Julie Paul?
Yes.
And by the time you engaged with her, she had her care had been transferred to Rebecca Gelada, correct?
Yes.
So fair to say you had the most contact with Rebecca Gelada about this particular patient?
Yes.
And if I mention December 2nd, does that sound familiar as the first intake with Lindsay Clancy?
Yes, as I said, around late November, early December. So that sounds about right.
Okay. And the intake appointment, was it in person with Lindsay Clancy?
Yes, it was in person.
And what were the services that were being offered for her? Why was she referred to you?
So she was referred to me for postpartum anxiety and depression symptoms. That's what she was referred for.
And in this first intake, did you go through that psychosocial history with Lindsay Clancy?
Yes.
And did you have some previous information from an intake with with Julie Paul, or did you do it fresh on your own?
Fresh on my own.
Okay. And so again, this is information that the patient is reporting to you about their history.
Yes.
And so in this instance, you noted that the defendant told you, or Lindsay Clancy told you, that she had had some prior contact with mental health, right?
Yes.
That she had engaged with a psychiatrist in nursing school.
I find her voice to be what I would perceive more natural within her natural register. And some women have a naturally higher register. The part that bothers me is when women are are intentionally talking or speaking in a higher register to appear more people pleasing, or they think that it's just an affectation that bothers me. I don't find this to be something that my ear pricks to there's something false to it, but it's not bothersome to me. The ums and everything are very bothersome, but it is what it is at this point.
And that she had been prescribed medication at that point, correct?
Yes.
And that she, prior to coming to the clinic, that she had been engaged with a psychiatrist.
Yes.
Did she identify what her concerns were, or what her presenting concerns were to you?
Yes, she did.
And what were the concerns?
Her presenting concerns were anxiety, lack of sleep, depression symptoms, frequent passive suicidal ideation, thoughts of wanting to die and no longer be here.
Oh my Bob Ross. She was able to effectively communicate with some insight into the perspective of Lindsay as a patient, her symptoms without looking at her little printout sheet and saying, I checked the box to say that she said this, this, and this.
And had she reported to you that she had been on a number of different medications?
Yes.
And you're aware that those medications were being managed by the nurse practitioners in the clinic?
Yes.
And as far as your role as a social worker, do you often kind of get into the weeds with patients about their medication?
So I'm not a social worker. I'm a mental health counselor.
I'm sorry.
Yeah, no problem. But
Uh-oh. Uh-oh. Oh, hell. Oh, hell. You done made an enemy, Commonwealth. I may not understand girls that are all of the girly magic that goes on with that, but you just done made an enemy. Pay attention with professionals and how they identify themselves, because the last thing you want to do with a witness is dear Lord. And here I'm the one being sent for evaluation.
But I typically have an overview of medications, but I don't particularly get into prescribing or how to take medications.
Okay. And so what's the focus of your role in offering counseling services to women with postpartum anxiety and depression at the clinic?
So my role would be to create a treatment plan to address the concerns, which would be like the anxiety and depression symptoms, and work on coping skills and building community supports around that. Or if she needed a referral to a higher level of care, I would do that.
And do you come to your own conclusions as far as diagnosis goes based on your interaction with the patient?
Yes.
And in this first interaction with Ms. Clancy, you got her history. You also did some of those assessments, correct?
Mm-hmm.
And so as far as assessing her present condition, kind of how she presented to you, did you make observations of her mood?
Yes.
And do you recall her mood being low, that she felt numb and unable to laugh?
I apologize. If it's medical record, I don't have any objection, but I prefer not the leading. I have no problem if she reads from the record, though.
All right. If you could just,
He waits till it makes the most impact until she's in her groove. And then he's like, look, I don't even care about this, but she has been leading the witness this entire time. Could she possibly stop? The snark impact of letting your enemy continue to make a mistake, and then you look like the magnanimous one, that you've been willing to overlook it, but now it's crossed a line.
there's objection, in fact, leading question sustained, but is there any, so there's no objection if this witness, if you want to look at your notes, I don't know if you have your notes with you.
I do not. Do they have a copy? I think they should.
I don't know if the parties have a copy that she could look at.
I do. I could.
Do you have a blank copy?
Well, I mean, it has like a date on it. It doesn't have a lot of notes on it. Just has a date.
I can approach page by page. It's fine.
Sure, that's fine. So if you need or want to look at the rec, just let us know. We'll do that.
Sure thing. Thank you.
I'm just gonna show you that page.
Sure.
I speak that with her.
Sure, yeah.
So, Ms. Dukes, on this particular visit on 12/2, what was her mood?
So she reported having low mood and feeling numb.
Okay. And so you said she reported. So in the note that you're reviewing, these particular questions or these observations that you noted, are they based on her reports to you about these areas?
Yes, and as well as my observation of her.
Okay. So did it appear that her mood was consistent with what she was reporting to you based on your observations?
She appeared to have, if you can say, like normal mood. There was no like tears or sadness, or like there was no blunted interaction. She was able to make eye contact.
Okay. And kind of moving to what's identified in your record as mental status exam.
Yes.
What is a mental status exam?
So a mental status exam is an exam that's assessing how the patient is appearing, what she is reporting, as well as any concerns about safety, which would be any suicidal ideation, homicidal ideation, as well as any intrusive thoughts or worry, any hallucinations or delusions.
Okay. And so in this exam, is it a mixture of what the patient tells you and what you're observing?
Correct.
Okay. And if I can approach you with another page. Page 53.
Thank you.
In regards to, on this particular first encounter on December 2nd, when it comes to the mental status exam, were you able to observe her facial expressions?
Yes.
And what were your observations of her facial expressions?
I do intend to get back into the civil lawsuit, but it is quite dense. It is 700 pages. And I am quite honestly, to be transparent with you guys, because I do have all of these wonderful intentions. I'm just working with very low energy. I talked to my doctor today about the fact that I just haven't been able to get restful sleep, and how important and how kind of just every day carry over tired, because I just never seem to feel like I get any rest. So hopefully when we get that back on track, I'll have a lot more energy, but it's just been a struggle the last couple months. So I'm dealing with cumulative exhaustion. My kind of general labeling of it.
She was tearful when discussing her anxiety symptoms.
Okay. And did you also ask those questions about thought content? You just have to answer out loud.
Yes.
Okay. And so what did she say about thought content?
So thought content, worry about her infant. And
Well, yes and no. I'm glad that I found a doctor that I'm comfortable talking to, and he's willing to listen and have maybe an active partner in my healthcare. So it is upsetting, but it's also I do have now an ally in my fight with this, and not every person is able to say that, and it's really sad.
that she had an addiction to Ativan.
And you said you also in this assessment assessed.
I'm fine, Jariah. I will probably about 4 is 4 is when I'm gonna probably crash today. We've got some pretty big storms going through, and I typically don't stream when storms go through. They are just extra hard on me. So I will have my rest, and we have some different kind of strategies to see if they work, and the understanding that this is not going to be an overnight thing, that even if I, start getting good night's rest with certain things, that there's still a cumulative, sleep backlog, that it's not going to be just a quick fix. So it's nice to at least have a doctor that helps.
suicidal thoughts, correct?
Correct.
And so did you ask her anything more about those passive thoughts that you indicated she reported?
Yes, and what she reported as far as like passive thoughts were thoughts of not wanting to be here or no longer wanting to live, but no plan.
And is that significant to you, the fact that she identified there was no plan?
Yes.
And why is it significant?
Because if she identified that she in fact had a plan, then that would escalate me to see it.
Okay, I am going to break this down and I'm going to try to be as delicate as I possibly can because of the subject matter. But very, very similar to the miscommunication of what a cry for help might look like if it's very subtle. Most people, if they're good maskers, aren't going to say they have a plan or not. They might not have a plan. I This is what really irritates me because I've always been one of those content creators who have felt like it was my responsibility to have one of the hotlines or one of the numbers up. Whenever I tell people, if you're struggling, go here, please talk to someone. And then to realize that the standard of care for some of these numbers, for some of these hotlines is, oh, you don't have a plan. Well, continue to white knuckle it until you do.
As a crisis and request higher level of support at that time.
As far as your observations of her thought process, were those within normal limits?
Yes.
And her intellectual functioning, were those within normal limits?
Yes.
Did she report to you any past attempts to harm herself or others?
No.
Did you go through with her her behavioral health history?
Yes.
And other than what you indicated as the anxiety and sleep, did she identify any concerns around substance abuse issues?
So she did identify concerns about, not in her history, but in that visit, about misuse of Ativan.
And if somebody expresses concern about that substance use, do you have a tool available to you to assess whether they have substance use issues?
Yes, so there is an assessment within the initial intake appointment that has a specific section to further assess substance use disorder.
And did you identify whether she presented with it?
How did none of you identify that the extreme hyper focus on the medication and dependence was in fact a cry for help? Again, cries for help can manifest in different ways, and they're not going to be the cartoon. Having a non-realistic, after you've talked it through, you've done the assessment, and you're not at risk, having an irrational fear that you will become dependent on this, it is a sign that she is having anxious, hyper, or at least a manic thought pattern she cannot get out. She's in a loop. If she has been given counsel, if she has been given support, and that these are still persistent, constant thoughts that will not leave her alone. Why did anyone not mark this as, well, she was just being weird about the medication? No, this was a cycle of intrusive thoughts. Those are intrusive thoughts, not just about ideation. Her constant worry about her children's health. All of these are constant. Why am I explaining psychiatry and mental health as a twice college dropout?
Any substance use disorder issues?
I did assess that she did not present with any substance use disorder issues.
And as far as her expressed concern to you, fair to say it was focused on the one particular medication, the medication Ativan, correct?
Yes.
And why did you not find that to be an issue based on your assessment?
Based on my assessment and how she stated she was supposed to be using it, it was used correctly to remedy.
Again, my mother effing flag. This is a red flag. Mental health professionals. If she is taking the medication correctly, if she doesn't have any assessed, substance abuse, the fact that she is in a spiral and cannot stop the intrusive thoughts about the medication is in fact a mental health sign that you should be waiting for. Am I taking crazy pills? For the love of God. Not to mention the fact that benzodiazepines do have an addictive quality. It is not outside the realm of stupidity or rationality to be afraid that you will become dependent on something that has a clinical history and is in fact in the news and in the culture of having really, really bad dependency issues.
The anxiety symptoms.
Okay. And after this initial intake, I guess the first question is approximately how long is this initial intake appointment?
The initial intake appointment is typically an hour.
And after having spent the hour, gone through these assessments, spoken to her about her history, were you able to come up with or give an opinion about diagnosis?
Yes.
And based on her presentation to you, what was your opinion about diagnosis?
At the time, my opinion about her diagnosis was postpartum anxiety because she had a lot of anxiety about most things.
Okay. And so what were your recommendations as far as a treatment plan for her?
My recommendations at that visit was outpatient therapy, continued medication, and weekly visits with me.
And why did you recommend outpatient therapy on top of therapy with you?
So outpatient therapy was kind of like a blanket therapy, but more so like intensive outpatient therapy, partial hospitalization therapy.
And was your role in offering her weekly sessions an attempt to kind of bridge services and make sure she was getting everything she needed, or something different?
To bridge services.
And so after that meeting with the recommendation for weekly visits, did you begin to schedule additional visits with her?
Yes.
And after that particular visit on December 12th, did you send her any particular information?
Yes.
And how do you do that? How do you send patients information if you're not able to give it to them?
I can send it through my chart messaging.
And on this particular day, after your meeting with her, you sent her some resources about cognitive behavioral therapy, did you not?
Yes.
Your next contact with her was December 5th. Why December 5th, if you had just met with her on the 2nd?
That may have been the soonest available appointment that week for her.
Okay. And it was shy of the 1 week, right?
Mm-hmm.
Was there anything in your meeting with her on the 2nd that made it necessary to have a shorter appointment?
No.
This next contact on the 5th, was that in person or telehealth?
Telehealth.
And on this day, on the 5th, when you met with her, did she report some additional information or report how things had gone over the weekend to you?
May I see my notes?
Sure.
Everything's fine over here. I am not sure if those calls went out when Pat was out of town. I've kind of shied away from the whole Patrick Clancy aspect of this trial. Mostly, I did not anticipate the TikTok insanity of making him Chris Watts 2.0, but I just felt like let's see. So I am not sure if those happened during his business trip, but I think it's also pertinent to remember that he had gone from a dual income house to a single income house. So he might have had to travel more. I know there are allegations of an affair and things like that. I haven't, I haven't dug into that part because honestly, the more important part to me and the bigger issue part to me is the lack of care that she got from the medical system. She just can't enunciate.
If it's okay, I'm just going to give her all the pages from that note.
That's fine.
Thank you. Yep.
Thank you.
Okay. I'm just reviewing the note.
Sure. Take your time.
And can you repeat the question?
Sure. In that visit on December 5th, did she indicate to you or did she report to you how the week?
No, this isn't the one that gave the opening. The one that gave the opening actually does the idiotic upspeak where she speaks somewhere up here and she always has to end her sentences with an upward intonation, making you think that she's asking a question. But no, in fact, she is making a statement for some odd reason with an upward inflection. I have never hated vocal intonations more than those offenses. Talking up high in your register as a woman, and then with the upspeak at the end. But the other one can't enunciate to save her life.
Weekend went for her.
Yes, she did.
And what did she say about the weekend?
She reported that over the weekend, she had a difficult weekend, having intrusive thoughts about wanting to die, and that she had contacted Aspire Crisis Support. She met with the clinician virtually and was told that she did not meet the criteria for inpatient treatment due to having no SI plan, suicidal ideation plan.
And so when she reported the intrusive thoughts and having a tough week,
Please tell me there is not a checkbox for an actual having a plan. I swear to God, please tell me that we have it that this is not the year 2020 where I don't have a jet car, I don't have a maid named Rosie who does all the cooking. My food is not in pill form, my pills are not in food form. Chocolate still makes me fat, and now we have instead devolved in human emotional, I don't know, IQ that we have to require a checkbox for a plan. I can't. This is the reality. This is the reality we live in. Dear Lord, help us.
weekend, did you follow up with her and begin to kind of talk with her about that?
Yes.
And what did she tell you about what she was feeling in those intrusive thoughts?
So in those times, what she reported was that it was continuous intrusive thoughts of not wanting to be there.
Oh, and Vacay Vineyard Vixen, I'm late with this comment, but I happen to know that benzodiazepines are one of the ingredients of a cocktail to delete. Is this counselor aware of this? Could that discovery not have led to a plan? Again, that's the thing. I don't understand how we can simultaneously put so many things are on a spectrum, but then not realize that cries for help might also fall on a spectrum from subtle to in your face. I struggle with the illogic of this.
But no plan.
Okay.
Kind of like the same report that she gave to Crisis.
Okay. And as far as kind of the difficulty of the weekend and how she was feeling, did she tell you how she was feeling?
No.
In that particular meeting, when she had talked about wanting to die or not wanting to be there anymore, did you kind of follow up with her about those statements and whether she had any sort of intent or plan?
Yes.
And did you ask her additional information and complete that full mental status exam?
Yes.
From that meeting? And were there any signs of psychosis or signs of mania or homicidal ideation?
No.
That is not the question that needs to be asked. The question that needs to be asked is, if they were subtle, would you have noted them? Would you have observed them if they were there, which I'm beginning to think it has been the case? Would anyone have noted them? And doggone it. Okay, you guys, it is looking darker than midnight outside, and the thunder is coming pretty much closer. So I am going to set you up to go over to Captain Kern and um, Snipe Hunter are doing a stream Stand Up to Cancer. So I am going to redirect you guys there. We will pick this up tomorrow after Mornings with Mo. But it does look like we're in for Stormageddon. So I don't want to fry my computer. That's one of my kind of terrors. So because this is an expensive one. So be safe. Be aware of your surroundings. I'm not the only one that's, in an area where we are in storms. So be aware of your surroundings. Do not drive through standing water, and I will see you guys tomorrow. Bye, you guys. Oh, where's the thing?